Okay, I think we're ready to begin. Is everyone with me? I will call the April 29th Select Board meeting to order. As a preliminary matter, I, Dawn Holgate, Chair of the Nantucket Select Board, will confirm that all members and persons anticipated on the agenda are present and can hear me. I would say just raise your hand if you can hear me. Members, when I call your name, please respond. Christy Ferrantella, Rita Higgins, Jason Bridges, Matt Fee. Thank you. Staff members, please raise your hand and let me know that you can hear me. I'm going through in order. We have the Town Clerk Nancy Holmes on, Michael Kozort, Superintendent of Schools, Janet Schulte, Director of Culture and Tourism, Erica Mooney.
Speaking here.
Libby Gibson, Town Manager.
Here.
Roberto Santamaria, Leslie Snell, Brian Turbett. I'm stopping with the titles because it's taking too long. William Pittman.
Here.
Jeff Carlson. Paul Murphy.
Here.
And then we have a couple of other guests. We have Nantucket Cottage Hospital, Gary Shaw and Dr. Pearl, Sarah Alger, our town moderator, Wendy Hudson, Nantucket Book Partners, and Bess Clark, I think, is on there. She'll be on later on the agenda representing the retail establishments. So with that being said, good evening. This open meeting of the Nantucket Select Board is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the Governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members are allowed and encouraged to participate remotely. You can find our agenda materials on the town website. Ensuring public access does not necessarily ensure public participation. However, we will be affording public participation via YouTube at certain intervals within our agenda. We will open up public comment. You will need to refresh your screen to be able to comment. Please keep your comments specific to the agenda item and try to form questions that we can answer, and refrain from speaking to each other in the feed. For this meeting, we are using Zoom for the video conference. Please note that the meeting is being recorded and all attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you, and to take care not to share your screen on your computer. Anything that you broadcast may be captured by the recording. Again, the meeting materials are on the town website. Meeting ground rules. I will recognize you in raising your hand. I may pull the board at certain times, and I will recognize our guests as we get to that point in their agenda. I mean, if anyone needs to get my attention, please do raise your hand. Please don't call out. It's easier if I could just see you raising your hand. Please remember to mute your phone or your computer when you're not speaking for the background noise, and speak clearly so that we can generate accurate minutes. I think that covers everything. We'll do our best to address any public questions or comments either during the meeting or after the meeting, if we can't get to everything. Okay. We will move on to announcements. The announcement portion of the agenda is mostly all of our COVID-19 updates and discussion items. I think that we're going to start with Wendy Hudson, who is one of the 17 people appointed for the governor's reopening and the state advisory board, which I know everyone is anxious to understand what the next steps are in Massachusetts. Maybe Wendy can give us a little update.
Yes, thank you. Can everyone hear me? Perfect. Yeah. Thank you for the invitation to be here. This is all fast moving, as is everything with this unprecedented situation. I thought perhaps for viewers that don't know me, I should give just a slight background on my business experience, Nantucket experience. So Wendy Hudson, I own Bookworks and Mitchell's, the two independent bookstores downtown on Nantucket. Also, my husband, Randy, and I started Cisco Brewers back in 1995. We have a long history of nonprofit and civic involvement here too. So I currently sit on the Nantucket Planning and Economic Development Commission. I was a past president of the Chamber of Commerce, Sustainable Nantucket. We just touch a lot of things, so I don't need to go farther than those, but those I think are relevant. Through the NPDC, I served on the state's Rural Policy I continue to serve on the Rural Policy Advisory Commission, which has been meeting 3 or 4 years on issues relevant to rural communities. Also, last summer, I was invited by the governor's office to serve on the Economic Development Advisory Commission, I believe it was called. So through those avenues, I became familiar to, the Baker-Polito administration, and I think that's probably one reason. The other side of my involvement here is because I am on the Retailers Association in Massachusetts. I'm the secretary currently, so I'm on the executive board. That was an organization that I got involved with on the book selling side when we were issues of sales tax equity versus Amazon. I just kind of started going to meetings. It's my personality. Many of you know me. I just keep getting involved. So by showing up at the meetings, suddenly you get on the executive committee. It's kind of how it works. And I remain there and feel very passionate about issues of small business. And so I think this is a good opportunity. And I was surprised to see the composition of this board they put together, the advisory board. It's smaller. The Economic Development Commission, by comparison, was about 40 people. We met. And this is a little different. If you were really going to make a big, board, so I feel responsibility to wear a lot of hats there to represent us regionally. It's not really the focus of this, and I imagine I'd invite lots of questions. But I think that's a big one. Is like, can you represent the Cape and Islands? And of course, I will try, but it's not exactly why I was put there. They did want someone from our region, but I think it was the retail experience that was a little more relevant. We've had our first meeting today, second meeting today, sorry. There was a conference, a Zoom yesterday at 2:30, another one today at 1 with the Retailers Association of Massachusetts. There are 2 lined up for tomorrow with Mass Bio and Mass Health, I believe it is. Another couple lined up for next week. We don't have, voting power. I don't have any illusions about, that I'm going to really get to craft policy. I think we are a sounding board. The governor's press conference yesterday did put a lot on this board, but having served on other things, I just, I don't want anyone listening to think that I'm going to really be able to shape a whole lot, but I do hope to bring, all kinds of issues forward and represent us well. So, I hope that's enough. I guess I addressed my question to the chair. If there's questions, I'd be happy to take them.
Thank you, Wendy. We appreciate it. I think we'll be looking forward to hearing more from you as things progress. Maybe you'll have an opportunity to come back on next week with an update.
Be happy to anytime, certainly.
Questions? I should just backtrack for a minute because we do have a couple of additions to our agenda and a couple of, we're moving things around a little bit. We do have a regional letter from Senator Sears' office that's been added to the agenda for discussion. We will take that up right after the update from the Cottage Hospital. And then after that, we will be moving the discussion with the moderator and the town clerk in regard to rescheduling of town meeting and the election. And if we do have our meeting scheduled for Friday, I think that this agenda is a bit long. We talked about probably the logical place to break would be to take the budget discussion up on Friday. We can always break sooner, but that may be the thing to move over to Friday because that's fairly significant. So with that being said, are there any comments from the board at this time? Jason?
Thank you, Madam Chair. I don't know if we're going to talk about the letter that went out to the second homeowners earlier this week at some point, but I just wanted to say, I've been saying this on the phone to at least a dozen people today and a dozen yesterday, that I did read the letter and I didn't see how it did come off to second homeowners and to businesses, and I didn't think it would have the ramifications that it did. So I just wanted to apologize to everybody that I did read it, and I did send an email to you, Don, that said, it looked fine for me and sign it. And I just wanted to get that on the record and apologize that I did read it, I looked at it, I just didn't see it coming that way. I think the clarification is good. Thank you.
Thank you, Jason. Yeah, I think that we all didn't quite anticipate the level that of angst that letter would create, and I do apologize for some ambiguities that were in it, and I hope that I hope that it's clear now what rules are in place, and that there were some directives in there that were more suggestions in terms of just being safe and how you think about coming to the island, but I think that we really did clarify that the governor's orders are in place till May 18th, and that currently it is out-of-state travelers that are specifically asked to self-quarantine, but that there may be best practices for everybody in terms of how we interact with people if we're worried about exposure. So I would apologize to the community as well for what it brought up. But I do hope that people are happy with the clarification and that the word is out on that. Matt?
Yeah, I'm sort of with Jason. I hadn't seen it until I got a phone call with someone, upset and angry, and I hadn't even seen it yet. So if something's going out and he's thinking that we've approved it and we liked it and everything else, we should at least have some comment on it. I think, and I think the clarification is great, but I still think that we need to talk about, we need to get some direction to people. All the calls I've received from and all of you guys too, probably the last couple of days have been, tell us what's going to happen. What's going to happen? There's some people who think they're going back to, the way things were last summer. There's other people who want it to stay as it is. It's almost based on, their own current situation, their own business, their own, whether they have enough money and they're doing fine or whether they're not. There needs to be, people need to plan. And I keep talking about sort of we have the elephant in the room. And if we're going to talk about it at some point, we need to put it on the table and say, what is going to be safe for us to do this summer? And how are we going to do it? I was on a phone call today with, or listening in on a Zoom to the National Real Restaurant Association people. They're talking 12 to 18 months. And, I'll talk about that later. But I think that somehow we have to, sort of give some direct guidance and direction to people. And we'll talk about that later. But I don't think that we've done that with the clarification. We've just tried to tamp it down. And at some point, we need to sort of explain how it is going to be different. So.
Oh, Wendy?
One thing I didn't mention to Matt's point on the timeline, the commission has a deliverable by about May 18th is what the governor had said, which is also the next date for something to happen. And I think Matt's right about managing expectations. It's not going to be like, and then we're open, at all. It's a very phased, very, very long-term, gradual thing that we're all looking at. And I would agree that the sooner people sort of recognize that, the better they can prepare and make different plans. I did want to ask too, Madam Chair, if there are no more comment or questions for me, I might take this opportunity to go do some things that I've avoided all day.
Thank you for being here. You do not have to stay.
Okay, I mean, I really would love to, but maybe I'll watch it later or listen on the phone or something.
Thanks.
But,
We will.
but please, I do want to invite everyone to reach out to me anytime. I really do want to represent us well, and it's a very ongoing conversation. So thank you all for all of your work.
We will look forward to hearing from you as we try to understand what the next steps are and try to answer everybody's questions and all of our own questions. Nobody knows quite how to plan right now.
Absolutely right. Okay. Thank you again.
Rita?
I just want to echo Matt and Wendy's comments, but particularly Matt's first comment there. I think as things move so quickly, I didn't see the letter until I was already getting phone calls about it. And I think when it has our name on it, especially, I think there's a lot of information out there and we're all getting texts and phone calls all the time. So just making sure that the select board just the important key parts that we have the information that we need so we can get the right information to everyone else. I also think that although the message came across not the way that we intended and the clarification has helped, I do think Matt and Wendy are correct in that this isn't going to be just a magic wand that gets waved. I think that what I've been seeing is business owners have been calling me and asking same thing, when is this opening? Do you think I can do this? Can I do that? And I've said, put it in a letter, send it to us. And I'm seeing a lot of creativity. I think business owners are going to be able to solve these problems, but I think that it's, the town, we're going to have to help people be creative with how they model their business this summer, but I think people should start thinking about it now.
Thank you. Shall we move on to the report from Nantucket Cottage Hospital? Oh, sorry, Christy.
That's okay. I just wanted to comment that I think the intention was right. We needed to prepare our second homeowners, and I think we also have to be thinking about public health. Governor Baker said it this afternoon in his press conference that we don't want to take one step forward and then two steps back. So we need to be working on communication and how to keep our community safe, because the last thing that we want to see is have us be shut down for the summer. And so we want to be thinking about businesses in the island as we're putting out these communications. And so I think the intent was right, and I'm glad that we put out the clarification. And I'm really happy to hear that Rita's also hearing creative ideas. I think we all have been hearing. It's going to be a different summer, and we're going to be creative this year.
Thank you. Can I turn it over to the hospital now?
Happy. We'll start out with Dr. Pearl, if that's okay.
Thank you. I have two bits of relatively good news, and one is that we continue to enjoy and experience a very low level of COVID-related illness at the hospital and in the community. And the second bit of news is that the Partners Healthcare system has expanded its testing criteria as of this morning. So we have been somewhat constrained in who we could test and who we couldn't. And now any outpatient in the community who has any respiratory symptoms can come through our drive-through screening and get tested for COVID-19. And that is a very big change, and it opens the door to significantly increased number of amount of testing in our community. So that's enormous. It still is not an asymptomatic person who is just curious and wants to get the test, but the person must have some sort of a symptom, as you all have read multiple times, the cough, fever, sore throat, muscle aches, losing a sense of smell, that kind of thing. But at least at this point, we can test you whether you have a pre-existing illness or an immunocompromised condition or any other number of things. So that's a big advantage now. Another piece of good news, as I'm sure you've all heard, was that the nursing home is uniformly negative among the patients and the staff members for any presence of the coronavirus. And the Sherburne Commons intends to go ahead with their testing as mandated by the governor I think, next week. So all in all, I have good news in my report. Thank you.
Thank you, Diane. And I just want to start by thanking Rita and Christy and Matt for a lead-in for some comments I'm going to make tonight. They are a little lengthy, so I'm going to read them. We'll also put them on our website tomorrow and provide them to the Inquirer and Mirror as well. So as president of Nantucket Cottage Hospital, I'd like to clarify and expand upon our position going forward. It is our mission to ensure the health and safety of all islanders. While we recommend safe behaviors, we do not regulate or enforce any actions by Nantucketers. Throughout the course of this pandemic, we have offered input on safe practices and safe behaviors, and Nantucket residents have demonstrated remarkable maturity and patience in committing to actions that have proven to benefit the island as a whole. By way of background, in early February, the coronavirus began to spread beyond China to Europe and ultimately to the United States. As challenging a problem as this was for our country as a whole, Nantucket was faced with some uniquely challenging circumstances. If COVID-19 took hold, it could be significant given the size of our hospital, the limitations of caring for patients during a surge, getting large numbers of people off the island if necessary, and the potential that our health system would be challenged and could not possibly handle a surge coming from the island. As the disease morphed from an outbreak to a pandemic, Nantucket was facing a significant health challenge. By early March, the hospital took as aggressive a stand as possible to discourage visitors from coming to the island, and for those already here to self-quarantine and to encourage physical distancing and other appropriate precautions. As we observed travel from several COVID-19 hotspots in the Northeast in March, our concerns multiplied, as did our guidance to restrict people's interaction and activities on the island. Today, thanks to our remarkably gifted staff, the incredible support, partnership, and professionalism from Partners Healthcare, now known as Mass General Brigham, and the impressive compliance from Nantucketers to respect and adhere to prudent social behavior, we currently have had only 12 confirmed cases of COVID-19 on the island that we know of. In fact, we experienced 23 days in a row with no cases. As we approach the spring season, we are faced with a new set of challenges. We know there are many who believe we must continue to restrict activity and commerce on the island with the goal of keeping the virus in check. We also know there are many others who would like the economy to resume immediately in an effort to save jobs and businesses which are now threatened. It is my belief that these two schools of thought are not necessarily mutually exclusive and that we may be able to achieve both of these objectives. The process of finding the balance is the purview of the town of Nantucket within the parameters of the state's recommendations and regulations, and in keeping with advice from healthcare experts, legal counsel, and the best interests of the community. There is little question that by maintaining tight reins on social behavior, we can keep the virus in check. We have done it before, and we can do it again. But in the same vein, living in a bubble is not living, and we are focusing our thinking at the hospital on the management of COVID-19 as the spring begins and how we will adapt depending upon the actions taken by the Governor Baker after May 18th. Of all the communities I've ever experienced, and I've lived worldwide, through my lens, Nantucket is a place where people exhibit a level of cooperation, cohesiveness, and consideration of one another that is unlike any other community. While the summer population is far larger than the year-round residents, it is my belief they too, by and large, understand the Nantucket ethic, which is what makes Nantucket, Nantucket. We're at a critical point for this island. whereby continuing to clamp down on both activity in the name of stopping any and all exposure to COVID, we risk crippling our economy, both now and for years to come, and causing a different set of problems that could, in and of themselves, impact the well-being of our residents. It is my opinion that we can achieve an intelligent balance toward the management of COVID-19 and protect the health of everyone who both live and visit here and keep commerce alive to prevent economic collapse. Moving forward, it will be important to rely on the intelligence and thoughtfulness of Nantucketers and the spirit of cooperation that this island has demonstrated time after time to determine our next steps. We are asking Nantucketers to continue following our guidance, which includes appropriate physical distancing by staying at least 6 feet apart, wearing masks in public when physical distancing is difficult, diligent hand washing for at least 20 seconds, not gathering in large groups or hosting large events, disinfecting much used surfaces with an EPA certified disinfectant, limiting trips to the grocery store and other essential trips, and adhering to the governor's orders, which will be adjusted on May 18th. If we do all these things, we feel that we can keep COVID-19 under control. Personal responsibility, self-discipline, respect for your neighbor, and compliance with public health and medical advice may be the most powerful medicine we have at this moment to manage the new disease. We have, as a community, proven our ability to work together, and our ultra-modern new hospital would not have been possible without the island working together for a common good. The hospital is as ready as a community hospital can be and prepared to address the tasks ahead. All of our Nantucketers, both on and off island, granted us, the Nantucket Cottage Hospital, precious time to prepare. During that time, we developed a thorough surge plan to expand our capacity within our walls if necessary, expanded the criteria for COVID-19 ambulatory testing at our drive-through to include any individual with any symptom of the disease, as well as training more than 26 Nantucket Cottage Hospital staff members in contact tracing to assist the town health department if needed. Nantucket Cottage Hospital is ready. If COVID-19 does flare up on Nantucket, you can rest assured the Nantucket Cottage Hospital will take immediate action that may involve recommendations to reinstate certain restrictions. At this moment, with support from Mass General Brigham, state and local health officials, I think it's important that we closely monitor the orders from Governor Baker's office and work together locally on the island to strike the right balance between health and safety and preserving our economy and livelihoods. We will continue to issue common sense guidelines that we expect everyone to follow. We've already shown that we can do this together, and I expect this will continue as we move forward as Nantucketers. Thank you.
Thank you. Could we open public comment now? And if anybody does want to comment, please refresh your screen and try to keep it to questions and no commentary between people who are commenting on YouTube. Jason, are you going to handle that one more time tonight? I think maybe Greg was going to next time because I don't see him on.
Yeah, I can do the best I can.
Okay. We can probably, while we're waiting to see if there are any public comments or questions for either the board or the hospital, maybe we could move on to the update on the emergency orders. Turn it over to the town manager.
Thank you. So with regard to the emergency orders, I don't think there's too much of an update, really no update on emergency order number 1, because that's pretty much been replaced with 5 and 6. 2, I don't think we have any update on that one. 3 is expired. 4, no update. That was a one-time item. And 5 and 6, I would look to Plus for an update about the construction phased work plan, which is order number 5. And then we do have some information in the packet, preliminary discussion for a potential phase 2 of construction, along with a potential process to follow for that. So maybe you all want to talk about those things. Maybe first off with an update. I saw Paul, there's Paul, with an update from Paul Murphy, building commissioner, about how it's going and that sort of thing. And then I guess if the board wants to talk about the kind of draft, and it is just a draft for phase 2.
Sure, I can give you an update. At this point in time, we've been busy accommodating the requests for return to work by the contractors, the multiple worker requests and the single worker requests. So we've been busy doing that. The multiple worker requests have dropped off quite a bit, which has allowed me to get 2 inspectors out into the field most of the day to visit, dozens of sites for, for checkups on enforcement of the COVID regulations. And that's going really well. We haven't issued any violations, but we have got involved in some discussions about corrective actions on the site because it's confusing to a lot of people, but the contractors have been very cooperative and they're very interested in making sure that this whole thing works. So once they've been spoken to about corrective action, they've been very cooperative. It's been great. I could give you an update on some of the numbers of, our back to work orders, if the board would like that. So I've got, at the present time, we've got 195 multiple worker requests. That's broken out into categories, renovations, weather tight requests, employee housing, waivers, sidewall, roofing, rough wiring, and some sewer work, totaling 195, I guess, as of mid-afternoon. And we have around 800 single worker requests, which drop off precipitously because a lot of those are one-day requests. But in total, we've had about 800.
Thank you, Paul.
Yeah, things are going well.
And any questions from anybody? Matt?
One question. I had someone contacted me and they would like to fix a roof, but it doesn't fall in the guidelines, but they're worried about, you can't really fix a roof by yourself. You've got to have someone on the ground. So, I don't know how we address that, but I think, safety and common sense, I think we could solve that.
Yeah. Roof work at the moment is under a single worker scenario, or if someone has a roof that's actively leaking, like let's say they've had a problem with shingles blowing off the house and the roof is actively leaking, I don't want to see it to get into ceilings and create further damage. So I'm taking that on a case-by-case basis, and I have had a couple of requests to actually replace the roof due to the fact that so many places of the roof were leaking that it was not practical to send a guy up there to address multiple areas that were leaking. So if anyone's having a problem like that, reach out to me and we'll reach a common sense resolution.
Before we get deeper into the building stuff, can I just go back to Jason to see if there were any public comments on either select board initial comments or on the hospital?
Sure. Why are masks not required for Stop and Shop?
Should we address that under essential worker order number 7?
Sure.
Roberto, do you want to just, he's saying yes, we'll address that under number 7. So was there anything that was specifically related to the hospital and not the emergency orders that we're into now?
I can go down each one. So the hospital's position on short-term rentals under 3 weeks is question mark.
I don't know if there is a position.
Okay.
I think we're all waiting on guidance from the governor.
Can you hear me now? Can you hear me now?
Yep, go ahead and comment.
No, I was talking, but I had myself on mute. I apologize. I believe the governor's orders are what need to be referred to for the backstop on what is in place for any of that activity statewide. And we're excited to see what his orders might become on May 18th, as is everyone else.
Thank you. Jason, are there other public comments? I'll get back to the board in a minute. I just want to close public comment and then reopen it again.
There's some on the construction, and a lot of it's on short-term rentals.
Is there anything we can answer on the rental situation?
For example, if a stay-at-home order is lifted, is it legal for the town to target and place ban on short-term rentals?
Is it legal for you mean the town to do something separate from the governor? Is that the question?
I can assume.
Libby?
It would be legal through a Board of Health order with the idea that there is a need to restrict, to be stricter than the state, just like we did with construction and landscaping. I have not heard the board really express a need for that at this point. But to directly answer the question, is it legal? The answer would be yes.
Matt?
Has that discussion come up at the, at the emergency group or the economic work group or anywhere? Because I feel like that's a big issue. People need to plan, and sort of we have to plant the seed now if we're going to, and we say we're going to talk to healthcare experts, I assume epidemiologists. What do they think of the 20% a week churn we have? And is there a way to lessen that risk? We shouldn't ignore that. I'm not saying we ignore it. We shouldn't wait on that. Bad words. We shouldn't wait and hope the governor takes care of Nantucket. We should be getting the information we need now. So if we have changes to make, let people adjust now. And I've talked about this for 2 or 3 weeks now. Who are we going to get? What epidemiologists? What experts? And who's going to look at our situation and look at the churn and look at how it will work. I think we really need that, because it's not going to come from this board. It's not going to come from our staff. It may not even come from the hospital if they don't have the right people in place. Who are the right people to look at that for us? I think it's a really important question.
Libby?
I don't know the answer really to any of that, other than we are waiting on state guidance, just like we are waiting on state guidance for restaurants and events and pretty much retail, all other industries that are not allowed to happen right now. The hospital doesn't really have a position. I don't know if they could refer us to an expert. I don't know if the state's reopening group, maybe that's a question that Wendy could put forward at that board. But every single town who has short-term rentals is in the same quandary as we are, including the Vineyard. So I know you've been asking about it, Matt, but if the board wants some specific action, then you, from administration anyway, or the emergency group, you need to let us know what that is. But I don't know who's out there that's an epidemiologist to contact to ask them, should Nantucket restrict? I'm not even sure what the question is exactly. But we are waiting on state guidance again, just like everybody else.
And whatever we are going to discuss, we've got to have some real basis in terms of why Nantucket would be more at risk to be different than the rest of the state and address all industries and things that cause turnover of people. Rita?
I don't know if this is what Matt is asking, but I think I think possibly an expansion of the economic impact work group. I don't know who we ask, but I agree that I think some of these problems are well beyond any of the experience that we have. And because it's quite specific, probably town admin. I think that it was mentioned last week by Gary that, the short-term rentals, the turnover of people, whether it's short-term rental, day trippers, possibly commuting workers, that's potentially where we're most vulnerable. And I think in that, maybe we're not more restrictive, maybe we are, but I think we should be proactive. So if we feel that for some reason we have to be more restrictive, it's well thought out. If we're not going to be more restrictive, then I think we should be creative and expansive in how we look at how we're going to mitigate the transmission and the vulnerability caused by short-term visitors. So I think it's one where we can wait on the state for everything, but I think more so than some of the other industries that are maybe a little bit more nimble, the short-term rentals, I think we should be not short-term rentals, but short-term visitors in general. How are we going to mitigate the possibility of transmission if we're not stricter than the state?
Roberto, did you want to say something? Or the hospital? Gary?
Yeah. I would say that you have an expert amongst you. That's Roberto Santamaria, who has a background in this, and he certainly is connected to the Department of Public Health that has many experts. And you do have quite a bit of education and talented individuals that are experienced with health and epidemiology at the hospital. So we're all here to help navigate this discussion. I think to Rita and Matt's point, you are waiting on the governor's back to work focus, what his plan would be. If it's anything, and I'm only speculating, like what the state of California proposed, I believe yesterday, specific criteria, specific understanding in different industries were provided. And you would hope that that occurs here. But if it doesn't, there's no reason not to be proactive, to think ahead proactively, start putting together what would be the criteria so that when you hear how the governor's orders are amended, you're ready to go. And commerce can move based on what you feel you've defined as what risk is there and how to mitigate it. So we're here to help you navigate that proactively.
Christy? Oh, sorry, Roberto.
I was just going to say, I think this is exactly what the Economic Recovery Task Group that Janet Schulte, Jason, and myself are working on, is trying to get the input from each industry and how they're going to reopen and what that's going to look like. I think it's really important to have the input of the industry and kind of what are their guidelines going to be before the select board makes any decisions. Some of the things I've been reading is there might be longer turnover time. So maybe you don't have somebody in a room, turning over every day, but every other day, and things like that might slow down, the churn that Matt is concerned about. But I think it's really important to have people at the table in these discussions. And if we're going to be more strict, I think that it needs to be a bigger discussion than just having us at the table.
Roberto?
So I just wanted to kind of bring to the attention, thank you, Gary, that I am an epidemiologist. It is the primary function of the work that I do for the last 10 years. And one of the things that we're doing is monitoring the spread here. One of the most important parts of monitoring the spread is to have data. Right now, when we talk about what if and what if and what if, that's not parameters that I'm able to study. We need to find what it is specifically that we're looking to study. The study question leads to the answer. And we can speculate all we want about what is the possibility of risk of the short-term rentals. But we don't have that hard data to find what that risk is. We have to test that hypothesis. And we just don't have it right now. So we know that it's a very frustrating thing to not have the answers immediately. And I am working with the State Epidemiologist's Office, with the Massachusetts Health Officers Association. I am in contact with all my colleagues off island as well as in other states to get this answer. But the point is, we don't have direct answers right now. And anything that we do, whether we go more strict or if we go with the governor's order, one of the aspects of that's really important to figure out is that no matter what it is, it's going to have an impact on either economics or health or both. And I think that is working together with the hospital and our colleagues off island, we're going to try to get that best answer we can to you as soon as possible.
Rita?
Robert, I'm just wondering, is what you're saying that it's not possible really to have a sort of, here are 3 plans. Brian Turbot did it with the budget, and I know that's static, but it's like, here's what happens if it's, 20%, 60%, here's catastrophic. And then we start to develop the if this, then that plan. Is what you're saying, is that from an epidemiological point of view, you really just need the data before we can even really contemplate what those might be?
We can work on definitely some predictive statistics there. Actually, we got an email recently. I do want to say thank you to Scott White he actually did a projection, 30-day projection on something like this, who he also has a background in epidemiology. And it is some information that we have, and but it's based on year-round community, and we can start looking into what the surge is going to be. We can work on information based on this tourist data that we have from previous years on what type of people are coming or who is coming, how many are coming, when they're coming. But we can't expect the same population or the same amount of people this year. So I can look into a 20% reduction, a 40% reduction, a 60% reduction, or things around that and try to set up a model. But what it really comes down to is those models are purely speculative, and we may end up basing major policy decisions on bad information.
Christy?
I was just going to comment. I think that's a really good point, that we don't think we're going to see the same summer that we're having. I think if we're going to try to be more strict than the governor, we would need to have a good reason or data to defend that. I think the hospital just said that, they're ready, they're prepared. They weren't prepared previously, and that's why we took extreme measures before. I think this time we go with the governor and then we collect that data that we need. It's not going to be a summer with 60,000 people like it's been in the past.
I completely agree with what Christy just said. I would be very concerned about putting in sort of new laws on Nantucket with no basis and actually being able to defend those. Jason, and then Matt.
Something else I just want to make sure that we're thinking about when we're trying to navigate through this really delicate balance is, what are the models when people don't have income and unemployment goes up 1% each tick, addiction, depression, mental health, domestic violence, elder abuse, sexual abuse, all these things also go up as well. I just want to make sure we're not losing sight of that, and we're looking at those type of models too, whether that's, and I'm sure maybe the hospital is already doing that with their social services, using fair winds, and just thinking about that as well, not driving that to open everything up, but that is one of the byproducts of all of this. I just want to make sure that we are thinking about the whole picture.
Thank you, Matt. And then Rita.
I agree with Jason that we've got to look at all the aspects. And I'm not saying we should be stricter or not. I want to know, what are the criteria? When do we make changes? What are those changes? We made it stricter on to begin with no data. We made it stricter on a couple industries, and it was the right move with no data. I'm getting questions from people saying things like, well, we've rented our house for 2 weeks. What happens if the person tests positive for COVID on the day 7 and they're in a quarantine for 14 days? What do I do? What about my next people? How long do the cleaners have to wait before they can safely go into a house? Those types of questions are coming, and I can't answer them. I think that, you guys can, I can't. Maybe, I think the restaurants have a good idea what they're facing. 40 or 50% occupancy, 6 feet of separation, a whole bunch of new rules are in place for them or are going to be in place. We've all seen them. Roberto shared them from the state or from the federal, and well, a lot of the restaurant people are having a difficult time and don't like them. They know what they're facing. I think some of these other industries need to know kind of what they're facing. How do they handle their customers if they can't answer simple questions? So that's what, mine isn't to say we have to be stricter. I want to know, what are we basing it on? What's, how are we going to do this? And the sooner we can answer those and give direction, the better.
We may want to look to some of what the other states are putting in place, because some states are ahead of us. And I will tell you that specific to short-term rentals, Airbnb put out guidance 2 days ago about strict cleaning protocols, leaving a minimum of 24 hours between rentals if you're certified for the cleaning protocols, and if you're not, leaving a full 72 hours in between rental stays. I've also heard some rumblings in regard to hotel stays about, like what Christy said, leaving rooms empty for a certain period of time, like cycling through the rooms, not being at full occupancy. So those kind of things may help the additional, kind of the travel industry. But it is, Rita, sorry.
Yeah, I also wanted to say that I think that I think it would help our businesses. I think, but again, it won't be this board that thinks through it, to take into consideration what this might look like. And I don't know that it's us being more restrictive. I think some of other states, I believe Vermont has extended no short-term rentals until July. And again, that would be devastating. And rather than waiting until May 18th and Governor Baker extends it, I think Jason's point about sort of the collateral damage that is done to outside of the economics, but also what our businesses might be doing. I think the thought process of the if this then that is not so much in relation to whether we get stricter, but if there's an extension of the ban on short-term rentals, or alternatively, again, because the islands are different. We make that case all the time, and we rely so much on tourism, have so many short-term rentals that maybe we're not stricter, but maybe there are other things that we can do, and using, really ramping up on if there's possibility to go above and beyond the state in terms of testing and tracing. I don't know that those are options, but I think that if we want to really try and balance the economics and the public health, I think if we think about it sooner rather than later, then we can be less reactive and protect our businesses better, as well as anyone who's caught again, one of these sort of collateral damage situations of being at home all the time. So I wanted to clarify, but I also do think that there's benefit in thinking through this earlier to the extent that we can. And I don't know if we need exact numbers. It's more of what happens if Governor Baker extends the stay at home, what happens for our short-term rentals.
Gary?
Yeah, I would just provide a comment and suggest to all of your points. When we do strategic planning at the hospital and we look at where we want to go in particular needs to address in the community, we pull together, as you've already mentioned, industry leaders from those areas and collectively sit down and plan together. And so I think you have an opportunity here with Roberto and many of you leading different focuses on what Christy represents, what industries are there, and motel industries. Everybody wants to talk about it and getting an opportunity to be proactive ahead of it. So when you find out what the new governor's orders are, you're positioned to rapidly move into things and have your community and those restaurateurs and hoteliers and others ready to go. So I would suggest a small focused working group on those industries that you have here and see what comes out of that. That way you have a focused, planned approach into the future.
Thank you. We did turn public comment back on, just in case anything comes up. We'll leave that on for a couple of minutes. Refresh if you want to make a comment. Keep it to a general question that we can answer, and please do not chat back and forth with each other in the feed. So we'll leave that open for a couple of minutes, and then we'll reopen again. Christy?
Yeah, I just wanted to reiterate that I think this is exactly the path that Janet, Jason, and I are taking in developing the economic recovery group. We're going to be having the individual breakout sessions by industry, and we are really eager to get to work. We worked on our mission. I know this is part of Janet's update, so I hate to steal it from her, but part of this conversation is we're going to be working with the industry. We're going to be asking for innovative and creative ideas. I think Rita's right. If it gets extended, what could we do locally? Could this be, short-term housing instead of inns? I don't know if that's possible, and just throwing things out. I think we're all going to be thinking creatively of how to support our businesses during this.
Thank you. Does everyone mind if we go back a little bit to the construction? Because we do have a phase 2 in our packet. I'm curious what the board's thoughts are on that. I would like to move into that. That gets to the roof problem that Matt's talking about and a number of other things that are being talked about. But this board would need to endorse it so it can get passed on to the Board of Health for review and talk about an actual implementation date. I would like our ultimate goal is to get kind of back in line with the governor closer to that May 18th date so that we can fall in line with everything that's happening, as long as we feel that it's safe to do so. We did initially put these extra measures in that specific to our community because the hospital wasn't prepared and the Mass General didn't have the capacity for us if needed, but maybe it is time to get some of these projects finished. But phase 2 does talk about still a limitation on number of workers on a site. It's limited to only currently open building permits, not new ones. So it's probably a good interim step. But anyway, I will stop talking and see what everyone else has to say. Maybe Leslie wants to make some comments, or Paul, or board. Jason?
If Leslie or Paul, or you could just clarify what are the main differences than the order that we passed last week or 2 weeks ago? What are the biggest changes?
Leslie, did you want to take that?
Sure. The biggest change would be that it opens up construction for any building permit issued prior to March 20th for which work commenced. It would not be subject to all of the limitations that are in the emergency order number 5. And it would increase the workers, as Dawn mentioned, from 4 to 8. And the order as it's drafted is consistent with some of the input that we've received from the Builders Association. We have been collaborating with them on this. I thank them for all their time on it. And I think that's it for the changes. The COVID-19 guidelines would still apply. Any project that's already received approval would not need to reapply. It would continue forward. Anything that would qualify under emergency order number 8 that doesn't already have an approval would have to follow the process that's already been outlined.
Jason?
So it would be 4 to 8 for any permitted jobs. What about a group of painters who don't have a permit to go in? Would that just be, where would that fall in? And what would that look like?
Yeah, I can answer that. That would be allowed because that's opening up, work for people that have to get things done. Painting doesn't require a permit anyway, and we're already allowing that for single worker jobs. So it seems to me that would carry through, provided they, adhere to the COVID-19 guidelines.
Jason?
Sorry, Madam Chair. So right now it's 1 worker for those type of jobs, Paul. Painting can go there. So I don't want to say unlimited, but so job sites can have up to 8 people total, or is it 10? Where does the state come in? I'm just trying to, this is a really good time to clarify those type of things before we, vote on it and push it over to the board.
Yeah. 8 plus 1 COVID officer. Generally, the COVID officer wouldn't be working. So 8 plus 1 COVID officer, that's less than 10 that the state is currently, leaning on. And, we have to put painting's essential for this in the sense that it's critical to your exterior. And there's plenty of houses on the island that need attention. And just because it doesn't require a permit, I think it's important to include those tradesmen in this back to work phase 8. This emergency order number 8 plan. I get a lot of requests for it, and right now it's allowed under the scenario of finishing up an exterior to bring it to total completion. So I think it makes sense to bring the painters in on this.
Rita?
Would it be 4 to 8 interior as well, though? It's not just exterior, is it?
Correct. Interior or exterior.
And then that's not something that we would really, if it's not attached to any permit, then it's not really traceable or enforceable. Or how does that work if it's not?
I would still like to see a request come in, a multiple worker request. Maybe we can make that part of the agreement, that someone wishing to undertake an 8-person paint job should notify the building officials. They will have a record of it.
Jason, then Matt.
So are we having 2 areas like we had before? We had permitted jobs. With this, this next phase could go up to 8, and then non-permitted jobs could also go up to 8. So if you had 2 landscapers, 3 painters, 2 some other things that doesn't need permits, what's the cap on that?
I would think 8 plus a COVID officer, if that's what you're referring to.
Matt, then Rita.
Just a quick question. It's for the hospital or maybe for Roberto. We've picked up 2 new cases this week. Did anything that we loosen lead to those cases? I know we don't need the details. I know there's privacy issues, but did our choices last week or the week before lead to them? Did these come from elsewhere? Were they on island people that were sick and just showed now?
I think it might actually be a little bit too early to tell that. With the 2, because there are 2 people on island, we can't release what work they do right now because it would be easily identifiable. But I think that would be a little bit too early to speculate that right now.
So Tuesday marks the first day, so that's the 5th, that the building and landscaping allowances were put into play. So this coming Tuesday would mark 14 days. Am I correct in that? In terms of data?
Yes, I believe Tuesday would be 2 weeks after it was put into place.
Rita?
A couple questions. Sorry, just to clarify again, it's 8 people per property. So my question, just a scenario again, I think it was Matt maybe, or Jason that had mentioned it. If you've got a project that doesn't have a GC per se, who's sort of organizing the various trades, and you've got 6 painters and 2 landscapers show up, and then a plumber shows up, is it 8 per property? And again, then when there's no one really organizing that, then we might end up with more than 8 at a property, is what I guess I'm trying to get at. Am I thinking about it correctly?
It would be 8 per property plus a COVID officer. So, anyone that fills out that form puts down who the COVID officer is, and we have a record of that job, and we have a record of who the COVID officer is. So there's tracking in that sense. Is that?
Rita?
So if there's a building project going on with 8 and they've got their COVID officer and then 2 landscapers show up, in theory, the 2 landscapers should leave, but there's no crossover between probably what Jeff is doing and what you're doing. I mean, that would be pretty complex, but is that in theory what should happen, is they should leave?
Yeah, definitely. and the COVID officer on that site should notify the landscapers that there's too many people.
Okay. One last question is I've been getting a lot of questions about landscape construction and how that ties into either building, because I think there's some scenarios where it's being done sort of under somehow the building permit, or I don't know if you've done special waivers for landscape construction. And so I don't know if our back to work building plan is meant to capture landscape construction or if that's meant to fall under its own phased part of the landscaping plan.
Yeah, I mean, some of the smaller jobs that involve, hardscape / small amounts of site work, not major site work, is kind of, I think, what you're referring to, like putting bluestone around a pool or that sort of thing is, I've been allowing that into single worker requests because it's not an emergency, but it's something that one person could in theory do. And people have been eager to do it in a one person scenario. But presently, the landscaping order doesn't provide for that. So those requests have been sent over to me, and provided they're done in a single worker scenario, any construction project is allowed if one person can undertake the endeavor. And so might be, backfilling a foundation or something like that, where one person shows up with a bobcat or, a scenario like that. So we have been allowing those. And, hardscape, I think would follow with this order.
So that would expand to allowing more people to do hardscape together and finishing some of those outstanding projects that maybe have HDC approvals, but not specifically building permits. Jason, were there any public comments coming in? Jason, then Christy.
There's too many for me to watch. So I'm trying to pay attention to this conversation. I apologize to everybody.
Let's shut those off, and maybe you can pick out a few in a little bit. But did you have a question?
Yeah, just so we had permitted jobs that needed weather tightening or they were year-round housing. It was up to 4 people, and then one person could register with Paul and Plus and go back. Now we're allowing 8 people for the permitted jobs, any permitted jobs, and then that one person that's for non-permitted is going up to 8. I'm just curious why not 4. Because the calls I'm getting is we need at least 2, Jason, so I can hold a ladder or check gutters or make sure there's safety issues. I'm just wondering why we're going 1 to 8 for the non-permitted jobs.
Well, I'm not sure. The request has gone to 8 people for any job that was stopped as a result of the order. So not necessarily, it's not now limited to the weather tight or the siding or the roofing. And, painting and landscape, painting and hardscaping, those are major parts of a construction project. There's interior and exterior painting. And I've gotten a ton of calls on it. And I mean, these guys don't hold licenses, but they're certainly integral to the completion of a residence, as well as the landscapers and the hardscapers. And it usually is associated with a building permit, because if you're undertaking work, if you're putting in a pool, for instance, to wrap that whole job up is not just, the gunite, it's the grading associated with it. It's all the hardscape associated with it. And, I consider all that inclusive of the building permit, in a general sense. The permit's for the pool, but there are other trades that are certainly associated with that project. And so to allow, more people on those jobs that or related to those trades that don't hold licenses, I think is pretty much necessary.
I think in crafting phase 2, just 1 second, Christy, and I'll go to you. In crafting phase 2, the discussion, didn't have a definitive timeline. There was talk of maybe sometime next week, but it was about trying to craft something that wasn't quite right back to where the governor is, but actually would get some of these jobs really completed in this time before we start to see another influx of visitors to the island, that might be to the advantage to have some of this kind of work wrapped up, especially with, you know, the hospital continuing to say that they are prepared and can handle things. And then, you know, there's always the option to pull things back. Hopefully we don't do something where we go 2 steps forward and a step back, but if we're careful about it. But this was meant to be a not go straight back to the governor, so that was a little bit closer to it, got these jobs wrapped up, didn't issue anything new, and did it in a way to make it feasible to actually get this stuff completed now while the island's still a little bit quieter than it might be later. Christy, you're next.
You actually answered 2 of my questions, which were how do we still differ from the state and can we allow any new projects? But you just answered those. The other one, so we're allowing with new building permits and HDC. So kind of what is excluded at this point?
No new building permits right now. And I believe the governor would have a limitation of 10 people per site because of the no more than 10 people can congregate. Someone can correct me if I'm wrong on that. Oh, Christy.
Just to clarify, I meant like previously it was only for, you know, year-round construction or weather tight. So now we're kind of opening up everything that has a building permit or an HDC. So there wouldn't really be a restriction of somebody not being able to do something, given that they have one of those 2 items.
Correct. But they would just be limited to 8 people. They have to follow all the COVID restrictions and guidelines, and there would be no new permits. Rita?
I'm just wondering, when we went from 26 sites that we thought the first one applied to, and it's at 195 now, do we have any idea of how many sites this would open up or how many permits this applies to? If it's, to Christy's point, if it's pretty much everything that's currently permitted. So.
Yeah, Leslie?
All right. Thanks for asking that question, Rita, because there's been a lot of, you know, misunderstanding about that. I mean, there was, you know, some math that needed to be done that wasn't included with just the number 26. The estimate that was provided to the select board was that there were new building permits issued for approximately 26 structures that may need to be made weather tight within the past 6 months. But we provided separate estimates for shingle work, roof work, and for renovation work or additions. So you had to do the math and add all that together, and people seem to be sort of fixated on 26 for some reason. So actually our estimate was not that far off. The year-round and the workforce and the employee housing as an exemption was added in after we provided that estimate, and that opened up a lot of additional permits that were not contemplated.
soon. If you guys were presenting something that said, let's do it now, and then we'll tighten up again in 3 weeks, we want to get it done before people get here and we'll tighten it up, maybe I'd be more in favor. My gut reaction right now is that we're basing this a little bit on, and I want to get people back to work, but we need to get them back to work safely. We can't be, we can't base on fear or on greed. We need to be basing this on, on data and what is in the best interest of the whole town. All of these businesses are in big trouble if they're closed again in a tight stay-at-home in a month or 6 weeks. So for long term, we don't want to be the greedy island that got COVID again. We don't want that to happen again. So how do we ensure that we do it safely? So I'm not comfortable pursuing it right now until until I hear more. And I would love to hear the hospital, Roberto, what their impact, what their whether they're in favor, what is their feeling on this? What's staff feeling on this right now from the hospital side and the Roberto side?
I'm trying to start my picture up, Matt, but I want to first default to Roberto, who really represents the town, and get his opinion, and then I can swing in. Is Roberto there?
Yeah. So the original draft that we saw said May 4th on it. And honestly, I think that's a terrible idea. We have anyone who can just look out and look at the people who are out there and driving on the trucks and how many people we have out there it's significant. And to open the gates again and to loosen it tight right now is extremely premature. I honestly, even in the discussion we're having now, I'm not exactly sure how laying bluestone for the deck of a pool even fits in the governor's orders. So I think we should really sit on this for a little bit and clarify and to really find out how the enforcement is going to happen. This really, I think it's too premature to have the discussion today.
Jason?
Roberto, it's premature to have the discussion today or to go forward today? I think it's okay to talk.
Sorry, to go forward today. Not we should have the discussion, but to go forward with this today.
Madam Chair, I'm asking for all these clarifications. So in case something does go forward, I'm going to get flooded with calls. I'm going to make sure I really understand it. That we're going from 1 to 8. I'd be more comfortable with going to 2 or 4, mainly for safety reasons. In the construction, landscaping's at 2, construction go to 2 or 4. That's why I'm asking what's the reasoning of going up to 8. That's kind of where I stand. I know the Board of Health's going to weigh in on it, and they'll decide. But I know Gary's might pipe in there too. But that's just where I'm at right now.
Yeah, I'm just curious what data we're really waiting for, and what basis we have to continue to be more restrictive from the state when the hospital says that they have the capacity. Maybe Gary could comment.
Well, we're ready to support the town in a number of ways. I think that Roberto's comment is, I'd like to have a discussion for some more clarity on the definition, and I think that's fine. Start having the discussion. And as we look at larger groups, we can work with Roberto and the DPH on what they're seeing across the state, where the governor already has orders that aren't as restrictive as what we have here, and what are those communities seeing. I think that can help give some guidance. But if we do see cases of COVID, we've got the tools to be able to identify that, quarantine and contact trace, and that's been our mainstay to date. So I think you just walk into this with diligence, and what you're doing now is having a focused discussion on what you're comfortable with. But if you're looking for data, look across the state where there hasn't been restrictions that are greater than what we've had here and what the successes have been, specifically if they're in a hotspot area. I think that helps you understand a little bit more.
Rita?
Yeah, I just wanted to clarify as well that you and I talked about when to have this discussion about back to work phase 2, and we want to start the discussion earlier, probably maybe much earlier, maybe not much earlier than when we were planning to implement it, because I think a couple of us felt that the last one was very rushed, and we didn't have, for me on the Board of Health and on the Select Board, it felt like the final drafts were very rushed. And I also think, to Roberto's point, I still am trying to understand what town council is saying as regards the state guidelines, and then trying to match them up with what ours are. So I think there's a lot to understand. It's happening quickly. We're in a good spot at the moment, but I think that as well, in the name of process, having some kind of 2 week, everything is sort of based around this 14 days. So I don't know that, do we need to move it forward before the 2 weeks and be consistent with that? And it does, to Jason's point, I think this does seem like a much, much broader opening of construction and landscaping. I think there's definitely some safety concerns, but again, if we're trying to do it slowly, this isn't slowly. If we're just trying to get it open and get some more numbers and data sets, then this looks to me like this is very open. But I think that instituting some sort of process, and this back to work, is it in the packet for the public? It is.
I think so.
Okay, so we should have some, and we haven't had much public comment yet on it, have we?
I know the Builders Association reviewed it.
Okay. Yeah, so I think having the discussion is important, because I think we're trying to, again, manage expectations for our businesses and get feedback. But I think in terms of the time frame, I think we should at least wait 2 weeks since we implemented phase 1, see how that looks. I don't know what data we're looking for, but I think if we at least have a consistent time frame, we can look for the same thing every time.
Leslie?
Oh, thank you. I'd just like to point out, I think Paul maybe touched on this a little bit, but our building inspectors have been going out daily. They were out over the weekend. They've been performing lots of inspections, and generally people are very compliant with the COVID-19 guidelines and following the rules. There have been a few where they needed some additional guidance, and a couple that, are not doing so well, but that's, just 1 or 2 sites. Overall, I think phase 1's been really successful, at least on the permitting and enforcement side of things at Plus.
Matt?
Yeah, I'll echo what Leslie said. I've heard from a couple of the a couple of the lumber yards, and one in particular said that everyone is listening. A few guys drive up without masks. They've asked them to get their masks on. Most are coming up one at a time, and and there were real concerns there, but they said they've done. Most people are very, very appreciative and are trying to follow the rules. So I will say that has been pretty good from everything I've heard.
Yeah, I'm concerned about having, knowing what we're looking for in terms of data and what kind of points we want to get to. I mean, I was certainly not advocating for this going into place anywhere before the 2-week deadline, but I think we need to make our comments on it, and then it ultimately goes to the Board of Health as an order. So they've got to set up a meeting and discuss it, and might want revisions. So it's about having the whole process done so it's not too rushed with the paperwork. And then the paperwork needs to get out there. We need about a 48-hour window just to translate everything and to get it posted. So even if we endorsed it tonight, you're looking at sometime later next week in terms of implementation. But I also I want to be fair to people. We have whole paving crews coming over to finish town projects and finish the hospital parking lot. We have the L8 project continuing. We have sewer projects continuing that are bigger crews. And I just want to be fair in how we're handling this and not singling out specific industries. Jason?
You make some good points there, Madam Chair. I think those, those bigger companies coming over are mostly pretty controlled because they're a bigger system and they're connected to Mass DOT and different things. our smaller jobs around here, it's hard to get the word out and educate. So just I'll quit talking about this, but I like it going to 2 or 4, starting at sometime next week. I think that makes sense. I think if I said this last week, I like 2 people being at a job site for construction. It's just better for safety. So 2 to 4 makes sense to me as a next step. And then if there's a permitted job that can go higher than that, and they can prove that it makes sense, that's kind of where from everything that I'm hearing, that makes sense to me. I just wanted to put that out there. Thanks.
Comments? Christy?
I was just trying to think, if these are HDC approvals, is that going to allow landscapers to have more than 2? Will that go up to 8, or is that just completely separate?
I think that would fall under hardscape. So landscapers that do hardscape would be allowed more people. I mean, I'm hearing from Jason that he'd be more comfortable with a slightly lower number, which, I mean, this is totally up for discussion. Rita?
I just wanted to clarify again. So landscape construction is allowed already at the state level with up to 10 people. Is that correct?
Paul, do you want to answer that?
Yeah, Rita, I'm not sure at the state level what's required. I've just been focusing on Nantucket, so I couldn't speak to that.
Okay.
Libby?
No, it is not allowed under the state order.
It's not. I thought it was allowed under residential construction.
It's pretty specific. Let me see if I can pull it up, because we got it from town council the other day. So just if you can come back for a second and stand by while I try to find it.
There really wasn't a limitation on residences.
Let me find it.
Okay, I have follow-up questions too. Just if it applies to only projects that are already in progress and still is a no on anything new. So that would be my follow-up question if it is allowed.
And I mean, if it's not allowed, then it just wouldn't fall under this, because we can't be less restrictive than the state on anything without a waiver from the governor. Libby?
So I'm just reading from wording from the order itself. It is going to depend on what sort of work it is. Okay, so construction related activities allowed by the state order include workers such as plumbers, electricians, exterminators, builders, contractors, HVAC technicians, landscapers, inspectors, and other service providers who provide services that are necessary to maintaining the safety, sanitation, and essential operation of residences, businesses, and buildings, such as hospitals, healthcare facilities, senior living, etc., required to support COVID response. So it's residential, essential operation, safety, and sanitation. Workers who support the operation, inspection, and maintenance and repair of essential public works facilities and operations. So that's just a whole different category of construction. Workers who support infrastructure such as roads, line clearing, utility relocation, et cetera. Again, a bit of a different category. Workers performing housing construction related activities, including construction of mixed use properties that include housing, to ensure additional units can be made available to combat the Commonwealth's existing housing supply shortage. Workers supporting the construction of housing, including those supporting government functions related to the building and development process, such as inspections, permitting, and plan review services that can be modified to protect the public health, including allowing qualified private third-party inspections. That's a bit of a different category as well. So I think it's sort of subject to safety, sanitation, and essential operation is the way we have been understanding it.
But it says residences. and increase in housing.
Yeah.
So why would that not include like putting in a front walkway?
Well, I
mean, it just seems vague to me that it says any resident.
Yeah, it's not crystal clear, but I guess it's
Massachusetts.
Yeah.
And we focus definitely more in phase one on affordable housing. Oh, Bill, sorry. I see you raising your hand.
Dawn, I think Libby read the entire list, but I think if you looked at the state's frequently asked questions page in regards to that landscaping question, they narrow it down even further to just say, and the question is landscaping an essential service? The answer is yes, if providing services that are necessary to maintaining safety, sanitation, and essential operation of residences, businesses, et cetera. So that's the end of it. So what you would read into that now, a sidewalk could be a safety exemption. You know, you're putting that in, but building a surround, you know, a landscape for a pool, that may not be a safety. That just might be some other type of enhancement. So you really have to get down to what's the purpose of the service they're providing. And, you know, it's basically for the safety and sanitation and essential operation, not for, you know, just making everything look pretty.
Yeah, so there would probably be some interpretation on that. Matt?
And that begs the question, do we have the ability, do we have the staff, do the police department, does PLUS have the staff to, you know, interpret and enforce this? You know, that one question. And number two, if our goal is to get to the state, then maybe that should be the discussion. You know, anyway.
I mean, that is another potential decision point, is to skip a phase two and put a date a little bit further out that just goes back to whatever the state's decided to do. And then there's less confusion. Paul?
Yeah, I just wanted to make a point that, you know, site work is integral to construction, you know, finish grading, walkways, steps, terracing. You know, I just want to let you know, it's, from my perspective, it's sidewalks and completing a site so that it can be safely accessed and things can be finished so that it's safe, you know, would include those finishing touches, in my opinion. So, you know, it might not meet, it almost departs from landscaping, kind of gets into site work, finish grading, finish site work, which falls under construction. And I think that's necessary for these residences to be complete. I mean, just from an off-island perspective, I know that in the town that I live in, there are, you know, construction is in full swing, and it is including finishing these homes completely so that they're ready to occupy. And, you know, so if you know, if the governor's, you know, off island, they're interpreting this order to mean a complete house, inclusive of finished grading and steps and terraces and hazards around a swimming pool that was just installed. That's all going on off island. So, you know, I respect whatever decision the board would like to make, but I just wanted to let you know, I think it's you know, it's not that simple.
Thank you.
Thanks.
Christy, you had your hand up, and Rita does too now, but Christy was first.
Oh, it got answered.
Okay, Rita?
I also just wanted to clarify as well, because a lot of the people that are contacting me about landscape construction, they're not tied to any active job site other than what's being done for landscaping. So I can definitely see what you're saying about site work, and finished site work, particularly for safety reasons, might be tied into an open permit or a new construction project. But if someone was just hired to build some walls and put in some patios, there would be HDC, but it's not an open job site. And I think whether or not it's integral or essential, I think that's where this really is this gray area. To Chief's point, I mean, again, if it's the safety, sanitation, essential operations, I think it has to be very clear how we are interpreting that. And I think interpreting that from a public health point of view, from a phase point of view, or whether, because even the state may not allow it depending on how you interpret it. I do think that there are some sites, again, not necessarily tied to a full-blown construction project, that have some unsafe situations where there is a retaining wall that is not filled on the back, or there's rebar sticking out. People who are living there year-round, or second homeowners who are coming there now. So it's a little bit like the roofing issue. I think there's some safety issues that could be sort of one and done, and fix it up with two people and get out. But I think I just want to be clear that we're that we're within the guidelines provided by the state.
I'm not sure where this leaves us. I mean, I think that the building commissioner is licensed to make these interpretations and to work with the state guidance and make determinations, and as well as working with our public health director on any concerns. But I mean, ultimately, this next phase, or lack thereof, if we just wanted to align with the state, is we need to send this to the Board of Health at some stage, and maybe we want to discuss it again on Friday. Christy?
Yeah, I was just going to suggest Friday and maybe having public comment to see some input. I know that I just started reviewing this, and I would like to at least get some more input from the community, and also understand a little bit more of how it relates to the governor's orders, and just wondering, are we being looser, or just kind of how do they align? So I would like a little bit more time to process.
That sounds good. Can I just have the consent of the board to put this over to Friday for discussion? Oh, Jason?
When was the Board of Health going to be looking at this? Next week? This week?
I don't think they haven't scheduled yet. I think that they were waiting for us to preliminarily have a discussion. Roberto is shaking his head yes.
I'm fine moving forward as is with up to 4 people, but it's at the general board. If everybody on the board wants to talk about it on Friday, I'm of course okay with that as well.
I think we should give it the time to, and we have a meeting on Friday, so let's just agree to put it over and move on to discussion on order number 6. I think maybe Jeff Carlson has an update.
Sure. Good evening, everyone. So just a kind of a quick order. Obviously, we entered into week 2 on Tuesday, so yesterday, and that opened up a few additional activities related to site health and site sanitation from the initial first week. We're putting in about, I'd say on average, between 8 to 10 hours, man hours a day on just active enforcement. So just kind of patrolling around the island and are making contacts as much as we can with people. We've registered 157 companies, which also includes single individuals for those specific landscaping activities, and have referred any other activity that's not on that list that we regulate through emergency order number 6 over to building. If it qualifies through there, we leave that to that determination, since our list is pretty specific. Other than that, we've been out on the ground. We've had a few issues where we just try to educate and help people if there's questions or concerns. We've been providing the order to folks in Spanish and Portuguese and English if requested. We requested a couple logs from people just to kind of get people used to reporting a little bit. And other than that, we've been answering a lot of questions, emails, phone calls. We've had our office staffed during normal business hours. But feel like this week's gone pretty well so far. The one issue that I think we're really having, and I think this is probably an issue from Order 5 as well, is we're seeing a lot of pretty good compliance with the single person in vehicles. In marked vehicles that have the company's name on the side, it's really obvious. But I think anyone that's driven around, there are a million trucks, whether they're, dump trucks or stake body trucks or pickup trucks around that don't have any markings and have commercial plates that have multiple people in there and you can't see what tools they may have with them or things that are there. That's my one piece of feedback really is that that's very difficult enforcement wise to know where they're going. And obviously we don't want to, follow everybody, but there's a fair amount of people moving around in two-person vehicles that may or may not be landscaping at times. But overall, we've generally seen compliance. So I think it's gone pretty well. I'm happy to answer any questions.
Questions? Christy? Can we open public comment for a few minutes in case there are questions from the public too? Please refresh, Christy.
Are we working on a phase 2 for landscaping as well?
Sure. So the easy answer to that is we've been working on phase 2 and kind of some of the activities that would be included in that. We've been working on that since phase 1. We haven't put it out for you guys to review yet. I'd be happy to get something together if you'd like to see what it is. We've also been trying to get as much feedback as possible from the landscaping community for things that are going well, things that are not going well. Obviously, they are also getting a lot of pressure from clients to deliver services and things, and that's a concern. And some of the other concerns have been related to things like larger properties, 1 or 2 acre properties, and crews being limited to 2, and wanting to increase or have 3 or even 4 folks on there. So we just kind of take a running list in and kind of put those together and see what it is. The other issue that's come up a bunch lately is when pool companies may be able to open up pools and begin treating the water that's already in the pools. And that's kind of come up as a discussion or a point maybe for phase 2 as well. So we'd be happy to put something together for your review.
Thanks.
Are there any public comments coming in? Any other board questions? Let's, I guess, close public comment if there aren't any. Essential worker masks, order number 7. I think there was a question about this earlier that maybe, Matt?
Yeah, just before we get to that, and just, if we're thinking about letting, sort of 8 or 9 guys on a job site and really, getting on construction, how do you tell the landscapers they can only have 2, and if they're living in the same home, I don't see any reason to put twice as many cars on the road. I mean, some of that we have to think about, but in all of this, I'm sort of thinking what should be attached with it. We should be getting something that's saying, this is what's happened. This is the number of trucks. This is the amount of traffic that's on the street. The amount of trucks that are out there. Here's how many guys are now coming over on the boat every day. Here's the impact from the hospital. This isn't going to show for like 3 weeks. Roberto will correct me if I'm wrong, but it'll start in 3 weeks or 6 weeks is when we'll go, oh, whoops. So how do we track it and have the right things in place so we aren't saying whoops later on?
Christine?
I think we've been getting a lot of that data of how many people are coming. It just goes to the question of how are we following it? I don't know if the data platform is still out there and doing anything, but maybe that's something that they could help us track. Just an idea to throw out there.
Rita?
I think if there's something that the data platform could help us with, I think the more information we have on those kind of things, the more we can craft policy to respond to it as we see things change or not. So I would agree with you, Christy, that I think it would be handy or helpful to have some of that information, and Matt as well. I think that's information that would help with any policy that we have.
Do we want to talk about what the next steps are for number 6? Jeff?
Yeah, that's all I was actually just going to ask Don. Is there a time frame that you would like to see that phase 2? Would you like to have it for your discussion this week, or would you like it for next week so the public can review too?
Is there any chance we could see a draft on Friday? Is that too soon?
I think I could try to get something together again for at least for discussion purposes by then. Certainly.
Christy, go ahead.
Yeah, I was just going to ask the same thing about Friday.
That would be great, I think. And I didn't realize that pools couldn't be treated with like the single worker thing. But
it's not currently covered under in Emergency Order 6. So I won't speak to the other ones, but to that one, it's not included as an activity right now.
Okay. Do you want to move on? So we'll look for a potential draft on Friday. I think maybe the chair of the Board of Health could join us for the discussion if he's available, and maybe Roberto can talk about number 7.
So order number 7 seems to be going pretty well. You saw that the Highline, many people saw that the Highline released a statement saying that they're going to require masks. It was actually on the news groups picked it up. A lot of businesses are requiring masks within them. The question was asked earlier is why have we not required masks of the public yet? And that would definitely go above and beyond what the governor's orders is. I know a lot of other towns are starting to do it. It's definitely something we can consider. I don't think that the fervor for it has really grown as much. We do hear on occasion complaints about there's no one wearing masks inside Stop and Shop, things like that. I think that's more of a management thing. But in order to order it, we can alter order number 7 to add masks in for everyone in public. But my sense from this board and as well as my board is that going above and beyond the governor's order is probably not really that recommended because it creates issues of this rephasing back. So other than that, I think it's gone pretty well. People haven't been complaining about not being able to get a hold of masks. I want to say thank you to the Get Sewing Nantucket group and the other groups here on Nantucket that are also building sewing masks for everyone. I think that it has actually been very effective in getting that out and getting the word out, and also pretty fun. Some of the masks that I've been seeing out there are really impressive. I've seen a few Star Wars masks and some Disney stuff. It's actually really cool. So thank you to you guys for doing that. And other than that, I think we're in pretty good shape.
Jason?
I think if we're going to go down that road to put an order in and enforce it and find people, I would like to see us really go all in on an education with masks, whether it's signage and just try to find other ways to get that information out. I think most people want to wear masks. My staff wouldn't work without a mask. Even if I told them that they didn't have to, they wouldn't even come to work without one. So I think most people want to wear the mask. And if we did an education campaign and we really, really did well with that, and then people weren't complying, then I think that maybe that would be the next step. That's just how I would think through that.
I would personally want to see some really concrete data onto why that would be necessary to inflict another order on Nantucket that is different from anywhere else, and that some kind of spread that was caused by people on the bike path passing into each other. And the enforcement is a nightmare. It's subject to constitutional rights challenge. I just see a lot of potential issues. I would just really want to see why we were doing it. I get the, asking the workers to wear it and why that action was taken, because that was really causing a lot of angst for people, and that's in an enclosed space. But asking every person who steps outside of their door to put a mask on, I think would be very restrictive personally. Matt?
Yeah, I agree with Dawn on that. Everyone going outside, if you're staying 6 feet away, I think that's fine. I do think, the High Line is asking its customers to wear them and requiring them on the boats. I think that's a great step because that is an area that's enclosed and may not have a lot of circulating air. I think that they did the right thing. And so, I think if we thought that was important for the airlines or for the steamship, then I think the Board of Health could just ask that in a letter, and that would probably happen like it did with the High Line. But I don't think we need to require it. There's a little bit of mask shaming. People look and say, "Where's your mask?" If you're in Stop and Shop without one, so.
Yeah, it goes back to some personal responsibility. Put a mask on when you can't distance from people. Did we have any public comments that came in? Okay. I skipped ahead a bit too much. We were supposed to talk about the regional letter that was coming from Senator Sears' office, and then we were supposed to have a consultation with the moderator. Maybe we want to skip back to the moderator first and the town clerk so that they can go if they want to. Sarah and Nancy, are you there? Hi.
Hi there.
I think for you, Sarah, we're at the point where you need to talk to us about another extension on the town meeting date.
Right. It's been almost 30 days, so I have a statutory obligation to come and speak with you, consult with you about further extension or recess of the annual town meeting. Currently, it's scheduled for Saturday, May 2nd. I know we had talked about continuing to Saturday, May 30th. That would still be my plan, with the idea that between now and May 30th, we'll meet and talk with town administration and whoever else you think is appropriate to figure out, A, if we want to go forward on May 30th, and if not, when we want to continue to again. Bearing in mind that I can only do 30 days at a time. So that's the story.
Anybody have any new issues with that? I guess you've consulted with us and we'll see where we're at when we get close to May 30th.
Yeah, I'll come back. Again, probably just whatever that meeting is right before your May 30th meeting, we'll have another consultation. But I think we're going to be talking between now and then, I hope.
Yes. Let's talk
see what we think.
We'll look at the calendar and start talking about alternate dates.
Right. I know if we go past June 30th, that throws you into some budgetary issues, but it may be that we just have to do that. But let's see how it goes.
We may have to discuss having an abridged town meeting and then another town meeting.
Right.
Deal with some of the budgetary things that are absolutely necessary.
So right.
We'll continue to talk. And the election as well. Nancy, I know we talked about a date of June 16th.
Right, and that was based on the town meeting possibly being May 30th. I think we just have to continue to go with the flow with this and see when we have our town meeting, because obviously we still want to do our pattern of having the town meeting first and the election to follow.
Actually, we started talking about that a little bit more, and we think that we're going to have the election prior to town meeting. We're not seeing
we have to do that's what we could do, but we still
ballot questions on next fall again.
Yeah. Which would mean that we would need to repost the warrant, and I would need enough notice to both order ballots and be able to mail them to the absentee ballot applicants, which at this point really aren't very many, because I think people were waiting to see what was going to happen, with the election. And we can also allow early voting by mail for the town election under the new governor's order. So I'll just need enough notice to have the ballots printed because I didn't have them printed, although they are waiting at the printers ready to go.
Well, I mean, we could certainly discuss now if we want to just commit to that June 16th date, but what does the rest of the board think? Anybody? Christy?
Would people still respond to the ballot questions and they just wouldn't be valid because we didn't have a town meeting?
They have to pass both. They don't necessarily have to be in order. It's usually helpful to discuss them at town meeting prior. So if they failed and then they were to pass town meeting, we could bring them back up again on a later ballot. Am I correct in that?
I believe you could, yes.
Michael Kozort?
Madam Chair, I wonder if the location will still be at the high school and what implications we have for that election. We obviously won't have students in the building, but I'm not sure if that has been decided.
If I could just jump in, Madam Chair, that would certainly have to be part of the discussion if you decide to go ahead and have the election. We do have to plan for social distancing, and because early voting would be allowed with the town election, not early voting in person, but early voting by mail, what that means is anybody can get a ballot. They don't have to say they're out of town. They can just request a ballot. Does have to be all done through the mail, and they're still counted at the polls on election day. So we would have to have a campaign to really highly encourage people to do that so that there are less people at the polls. And another thought that we had, if the school would be amenable to this, is to reduce, to maintain social distancing, we could consider setting up the booths in the gym, in the gymnasium, because there's more space, because we're going to have to socially distance the booths as well. And I would want to try to do the election with less workers and less check-in people, just to reduce the amount of people that are near each other. And obviously they would have to be socially distanced as well. That's what a lot of other towns are doing.
Jason, or actually, hold on a second. Michael Kozart, are you open to it happening at the school? And then
we could accommodate that. I'm certain we could accommodate that.
Thank you, Jason.
Just listen to Nancy thinking about putting it in different places. Could it be outside underneath the awning there? Everything outside is better, right? With airflow and. There's nothing
actually wrong. Yeah, the state elections division said that as far as having elections outside, it's maybe, and so you have to sort of look at ADA access. Obviously we'd have to have power for the ballot machines. Personally, I would love to do it outside, but if it rained, we'd have to make sure we had probably a tent to protect everybody. But I don't think it's out of the realm of possibility that we do that. We just have to be prepared for inclement weather.
Libby?
Whenever we do have...
Sorry.
Go ahead, Nancy.
I was just going to say, whenever we do have the election, we really have to push, no matter when it is, through every social media means that we have, push people to vote by mail. It's more work for us, honestly, because we have to process each ballot by hand and we have to open them from the envelopes and feed them through the machine. It's a lot of time, but it would be safer, especially obviously for this first election that we have to get under our belt, the town election.
Libby, and public comment is open if there are any public comments on this.
I was just going to add that changing the polling place is kind of a big deal. There are a number of requirements that the state has, and then they have to come and do an inspection of your site. And we've already started previous to this looking at some other sites, none of which met their criteria. So that's how we've continued to end up at the high school, which obviously is pretty common across towns. And then there's a specific notice requirement if you were going to change the polling place, which I highly doubt at this point we're even in the window of. And if we are, the state is not going to be too happy to hear towns completely changing their polling places, I don't think.
Yes, sorry, Matt, I agree with Libby on that. You know, that is absolutely true. I think that if we were changing, you know, if we were able and agreeable that the gymnasium might be better because it's bigger, that's essentially the same polling place, right, Libby? So we'd be good there.
Matt?
Yeah, just a question for Nancy. What would it entail to get other election employees, either younger people who may not be as susceptible or people who maybe have had the virus already that may have immunity? You know, is that something that you guys would look into? Is that possible?
I think that's completely possible. You know, technically, election workers are supposed to be approved by you as the board. You approve a big, long list of people every year, generally. But I think under these circumstances, you know, pretty much anything will go. And certainly we could add people to an agenda. But I had a Zoom meeting with the Cape and Islands town clerks this afternoon in a few towns on the Cape. I know Falmouth is one, and Sandwich, and I forget the third. They have a combined town and state election, and that was scheduled for March 31st, and the state let them change it to May 19th. And they don't think they're going to be allowed to change it again. They're already sent out many absentee ballots and so forth. And several of those clerks said that all their election workers, which are of course older retired people like ours, almost all of them across the board want to work. And the clerks were honestly very surprised about it, how eager they were to work. They said, well, I think they're just cooped up and they want to get out. But we could certainly make an effort to ask younger people, or perhaps, as you said, people have already had it, but I would hate not to go with our election workers first, because A, they're experienced and trained, and B, they'd be deeply offended if we don't ask them first.
No, and just real quick, I'm not asking but I would, if it were my parents, I would be advising them not to do it. If they're comfortable doing it, if there's then that's fine. I just was throwing it out there.
Sure. Yep.
Roberto?
So just not to throw kind of a wrench into this, but there was an article published in The Lancet yesterday or 2 days ago now that says that just because you have antibodies for this doesn't mean you're immune to it. They're finding that some of the antibody response is actually not an immune response. So just because you had it doesn't mean you can't re-get it. So it's... Yeah, and it doesn't mean you can't pass it along either. You're actually shedding the virus for a while after you've stopped showing symptoms. So the information on the immunity is still coming, and it's still preliminary. So that is just something we have to kind of consider, that come the fall for the presidential election and for fall town meeting and annual town meeting and all these other things, we may not be out of this yet. And it's just a tough decision that we all have to make. There was a comment on one of the, I believe it's on YouTube now, about getting a tent and going outside, doing the election outside. That, I don't know if that's something that's viable. It might not be a bad idea.
One of the Cape towns today, and I just couldn't get which clerk it was because I'm not familiar with her, said that they were doing their town meeting outside under a tent.
That might be something we need to look into. It's tough that it's a tough call, and it's a little disheartening to hear that the antibody test doesn't necessarily mean immunity, but it's new information. It just came out in the Lancet 2 days ago. For record, for the people who don't know, the Lancet is a highly respected global medical journal.
we're going to have to figure out a way to safely, or in the safest way possible, to live with this until there's a way to eradicate it. And I think we all have to come to terms with this. Another month of lockdown of anything is not going to fix it. So we have to institute the best protocols we have available to us and still be able to function as a society. But Libby, were there some public comments you wanted to mention?
I just wanted to say that it looks like there's about maybe 3 that came in. One of them was take the questions off the ballot and have a fall town meeting. That's not really a question. Will each voting booth need to be sanitized between voters? This is from, I should say who they're from. This one's from Mary Longacre. I think the answer is probably yes to that, but Nancy could address that.
Well, you know, I personally think that whenever we do have the town election, I do think that we can have a safe election. And one of the first ways we can do that is certainly by encouraging people to vote by mail, to early vote, because that's not normally allowed for town elections, just absentee was, when you have to swear you're out of town. But I think we would have to set it up so not only are the workers safe and the booths themselves socially distant, but we would have to have, you know, sort of do things differently where we have a crew that's standing around with spray and wipes, and their job is to wipe each booth. What some towns are doing is giving each voter their own pen and then putting those pens in a discard box and sanitizing them and using them again for a later election. And I would like to do that rather than obviously have the pens in the booth. So, and asking people to wear masks, asking people to vote by mail. A lot of clerks are buying plexiglass to protect the check-in folks. Some are not, because people come and they're still standing over them. So they're putting a table in front of the check-in folks to just sort of make a social distance. But I think it can be done. And I think also the bottom line is, if you don't want to come to the polls, you use the other option and you early vote.
Thank you, Nancy. So there'd be a whole lot of protocols, and we'd all get all those out by social media. There seems to be one more comment from Albacore Charters. Get Sperry tents to put a tent on the baseball field. So that we're going to be discussing a lot of options. That would be for town meeting, not the election. We can't do that for the election. But there's going to be a lot of different options talked about for town meeting. And Sarah and Nancy and I are meeting with some others on Friday to start hashing that through.
Okay, great. So is there a consensus on moving forward with scheduling the election for the 16th? Sarah, did you have a comment?
Well, I just wanted to remind you that we are subject to the ADA. So anywhere we have our meeting, it's going to have to be a paved surface.
Thank you. Is the board okay with going forward with figuring out a safe way to schedule the election for the 16th? I'm seeing yeses from everyone on that. So let's move ahead with that, and we will look forward to consulting with Sarah on the town meeting date and options of where to have it and how to have it, the meeting before May 30th. Sound good? Okay, next we do have... Oh,
excuse me, Dawn, I'm sorry. Can I just clarify then, is that a definitive for June 16th for the annual town election?
It is.
Okay, thank you.
Is public comment off now?
Yes, can we turn public comment off? Well, except maybe we should have it on for Senator Sears' letter in case anyone wants to comment on it. That is in the packet, correct?
That is not in the packet. I didn't receive it until tonight.
Maybe we should put this over to Friday so that it can be distributed publicly for comment. It's got some similar information in it as the letter that went out from us. So I think I would really like to have public comment on it if there is any. How does everybody feel about pushing this to Friday? Okay, I'm getting thumbs up, so I'm going to go with it. We will move that to Friday. We've gotten through the emergency orders. And now we have the Board of Health update on restaurant inspections. So Roberto, you are up again. And we could turn on public comment now, refresh in case there's any questions or comments on this. Again, please do not speak back and forth, just ask relevant questions.
So thank you. For the restaurant inspections, they're still going to start on Monday. And so far, we only have 15 inspections, people asking for inspections next week. So it's like a normal week in April. So as we're getting paperwork in, we're processing the applications. When we went to go schedule some of the inspections for next week, we've had a couple, more than a couple, most of the restaurants so far have said, please push it back to May 15th, or one of them even asked us to go back to June 1st. So, sorry about that. And then, so June 1st is on for some of them, but we're moving forward with the inspections on Monday. And we're pretty happy with how things are going. We've been working back and forth with those who are contacting us. And then as far as the letters go and the guidelines go, we're working on the guidelines with the group that we have set up. And I have right here, so I can read a quick portion of it. So a lot of the protocols for the reopening phases of the businesses, including the restaurants, will be dictated by the governor under the advice and counsel of our recently established reopening committee. But we do see that some of the expected parameters that the restaurants will be facing over the coming months include continuation of delivery, pickup, and curbside services, phases of reestablishing on-premise service to include reduction of occupancy. We've seen in other states that reduction of occupancy can be as low as 25%. So we're hoping that it's more than 25, but I know that can be a little rough. Social distancing between parties and tables, no walk-in services, but we're also looking into every restaurant is different. So maybe we can start setting up more of the option of reservations, call ahead, or electronic queuing. We're also going to be looking into face coverings for all the staff for the foreseeable future. And we're also getting guidelines, well, not guidelines, but we're coordinating with other health departments as well to see what it is they're looking at. But the guidelines are meant to give the ability to work on various stages of the operational plans, so we can assist in as many of the matters as we can. And we're prepared to respond to as many of the parameters that the state releases once they finally release that. And should be I think that's really everything.
Are there any public questions that came in? Libby, are you taking a look at that?
William Cassidy asks, has there been any further discussion of street closing to accommodate outdoor dining?
It's definitely not a bad idea. It is something that we're looking for. I'm sorry, I'm freezing in here. It's definitely something that we're looking into. We do know that some of the sidewalks are incredibly narrow, so we're going to look into how that would work, the logistics of all of that. It is definitely something to discuss, but nothing's concrete yet.
Matt, did you have a comment on that?
Yeah, I spoke to a couple of people that own restaurants downtown. They'd be in favor of that. I was on a call today, was just on a Zoom call with a national restaurant group, and they were talking about doing that in some cities. Some places are doing that to help the restaurants. A lot of the restaurants are too small to really get 6 feet and to get the separation. If they were able to go out on the nice days, that would at least help them a little bit. People have to realize restaurants have very low margins. If they make 10%, they're doing really well. If they lose 50% of their business or 50% of their meals and 80% of their bar business, most are not going to survive. Most are not going to make it. There's high fixed costs, especially the rent on Nantucket that has to be considered. And some of the numbers that they threw out today, the meeting I was at, 60% of the unemployment in the US is restaurant workers. 60% of the people that apply for unemployment insurance are in the restaurant business. 80% have responded to surveys and have said that the loans, the PPP loans, will not work for them. That's because of the timing of all this and how this is happening. They can't bring their staffs back. They need grants, and the expectation that they're building, among these small restaurants is 12 to 18 months. That you're going to be living with this for 12 to 18 months potentially, and so that's where they're doing a lot of they're trying to find creative ways to do it. The street thing would be a good thing, but I think that it is really, in that industry particularly, it is dire, and I think we're going to find I guess they were saying 80% of the people in that industry don't think they will survive this. The small businesses. Now, some of the larger ones are in, sort of better shape. They've got investors, or they've siphoned off a lot of the money, so some of those are in better shape, but a lot of the small businesses are really in rough shape right now.
Yeah, that's spot on. Matt is spot on that. When the data started coming out about a few days ago, and then that article in Lancet about the immunity, that's when we started looking at a 1.5 to 2 year event. There's some good news on the horizon. Oxford Scientific is looking at finishing their clinical trial in the fall for a vaccine. But we just, obviously we can't wait for that. That's the fall. So I think Matt has hit it right on the head, and we need to look into the opportunities to keep as many of the businesses afloat. We have a fiduciary responsibility to the economics as well as to the health of the island.
I personally support any creative ideas that we can come up with to help support our restaurant businesses. It's an industry that I'm very, very worried about, and it's the time for us to get creative. And I am also hoping that we can finalize an agreement with National Grid so that we have that valet lot available, which would help in the ability to maybe close down streets in the evening. So just wanted to mention that. Rita, you had your hand up, and then Jason.
Yeah, I just wanted to add that I think the possibility of using sidewalks and closing down streets, I think that would be, I think we should definitely look into that. And again, to your point, Don, hopefully there's other ways beyond that we can sort of get creative, and businesses can get creative to make it even better than that. So, but I definitely, I like that idea. So I think we should look into it.
Jason?
Thank you, Madam Chair. What I'm hearing from most of the restaurants and seeing is everybody wants to know when, of course, when things are going to happen, but a lot of the focus has been shifted towards the how. I think I heard that at the beginning of this meeting. And I don't know if the draft is just a draft, Roberto, but some of the feedback I was getting, just to put it out there, was the 2 seatings times could bottleneck people in. If they stagger them, it can spread people out. The 10 p.m. closing, people kind of question that. And then there are some, I like what you said, Roberto, by kind of looking at this as, restaurant, if we can, to be creative. There are some restaurants that are so big, if they did 50% occupancy, they would have less people than if they had 6 feet apart from different tables, because, and then it could go outside. So I think there's a lot of people are going to fall into different categories. I know the state's going to push this a lot, but I like what everybody's saying from the board and Roberto of us trying to be creative with occupancy and to work within the rules, but to help these restaurants as much as we can. So all good things I'm hearing. Thank you.
Any public comments?
Yes. Do you want Christy first?
Yeah, Christy, go ahead, and then read a couple of comments.
Just 2 things. the draft in the packet from April 9th, the most recent draft for restaurants? Because I thought we had addressed the 2 seating.
I think I don't know if the newest draft is in.
I was never given any further drafts since the first one, so it's
I don't
still
know
the
if
original one in the packet.
Yeah, I don't know if the new draft was in the packet at all, but it's definitely a conversation that's being had. The 2 seating thing, a lot of good points were brought up about people congregating, coming in for that specific seating. So I think that's kind of being brought, that's being shot down. But there's multiple options. I think every restaurant is different, and the people who own the restaurants know what's best for their restaurant. So we're trying to make it work, including the retail. We're trying to make it work for everyone. Occupancy limits. I think we need to understand that the occupancy limits coming from the state are not going to be negotiable from our standpoint. So we're going to, like Jason said, we need, and Matt, actually the whole board has been talking about, we're going to have to start looking into really creative ways on keeping everything afloat.
Yeah. My second thing was just a comment that, opening up the streets to restaurants is going to really help the whole downtown, and it's going to help retail and others and art galleries. So it is looking big picture, even though I know we're focused right now on restaurants.
Maybe we can get whatever the most up-to-date working draft is in our packets for Friday, so that that's out to the public to see how the revisions are progressing. I know we're still ultimately on most of these industries, we're waiting on state guidance just to see what's coming down, so that we don't write something that's less restrictive than what the state writes. We're going to need to at least be somewhat aligned. Okay, we can turn off public comment, I think, on restaurants. And economic impact work group. Janet, you're up.
All right. I will say that I invite Christy and Jason to jump in after I finish what I will describe as what we've been up to. The 3 of us have met a couple of times and had email exchanges. We have identified sectors that we want to include, economic sectors that we want to include on the membership of this recovery group, as well as some kind of blue ribbon people, so town officials and then a few other folks that we think have something to contribute. We've identified a mission statement, a process that we want to follow, and a timeline. That process will involve having the sector reps who are at our meeting hold sort of roundtables with their sectors to identify what is it from those sectors that they can identify that will help to draft opening plans that make sense for each sector. We also think that there will be some creativity in the overlap of these sectors talking to each other, because we think there are some commonalities, but we know there are some distinct elements for each of those areas. And again, it's about getting to the how and not the when. I think it's also very important that we communicate early and often that this is going to be a phased approach. I've been having a series of conversations with different sectors groups already who think that when the governor says we're open, they're going to flip a switch and it's going to be back to normal. And we need to make that clear that it's very phased. And everything that I'm reading that Libby and Matt and others have been sending me from other states are all documenting phase 1, phase 2, phase 3, and these phases are anywhere from 4 to 8 weeks long. So this is going to be a long process to get people back, but we really want to engage the sectors in this discussion. As you just said, Madam Chair, we don't want to be less restrictive than the governor, but we do want to get some kind of inputs about what is it that will make Nantucket's recovery unique. So I would turn now to Christy and Jason to add to that. And we're planning to have our first meeting either late this week or early next week.
Thank you. We could open public comment in this time to see if there's anything in relation to this work group. Jason and Christy, do you want to make some comments? Jason?
I think Janet did a great job of describing what we're looking at. In our first couple of meetings, we kind of went back and forth on how do we make this really effective, not waste anybody's time, and how do we make it different or expand on what's already happened with the town, economic task force, and the chamber. And we came up with a lot of guiding questions to get us started. But Janet really she nailed it all about of trying to work creatively within the regulations from state and local. How can we be just creative? I mean, Roberto even referred to that earlier. And then protocols. People know their industry really well. They want to do it right. Everybody has every incentive to be safe and do this right for their customers and for their staff, for their community. And so they have really good ideas on protocols. Certain industries might want to add protocols on top of the state just because they want to be more safe. So we want to hear those type of ideas. And then the last thing that I really want to try to push is that cross-discipline idea sharing. I think when the real estate industry is talking to retail and retail is talking to transportation and everybody's listening to each other, I think we can come up with some really great ideas and solutions.
Christy?
I think Janet and Jason really covered it, but I think the one thing I wanted to contribute is we're really looking to the industries to be a part of the conversation and have this public-private partnership where we're all working together to get the whole island open. And some of that is talking about how to get town offices open or which town offices will help which industry. But when we go to each industry, it's really going to be asking them to help us. They need to do the research on their industry and what are other people doing. Like Matt said, listening to the National Restaurant Association or National Lodging Association and helping us. We don't want to go in and create the policy. We're going to really be partnering with everybody.
Janet?
And I think it's important too that to reinforce what Christy just said, that the industries are talking with other communities about what is going on with the industry in those other communities and their own professional associations that are developing a lot of guidance based on CDC regulations. And that's really I believe on them to bring to the table to make this discussion deep and concrete.
Thank you. Were there any public comments on this particular item?
Looks like there's one. Who is on the work group from Albacore Charters?
We have identified individuals yet. We still need to talk. We'll probably talk tomorrow about making those calls and see who comes up with. But we've got a list of names. I don't have that in front of me right now. But it represents every sector from retail to transportation and delivery services, restaurants, lodging, the whole gamut. I can't even think of them all. But there must be at least 15 sectors that we identified. Between using the chamber guide and our own sort of knowledge of the community.
If you've constituted the group by Friday, maybe we could have that list in our packet because other people might want to speak to those members about their concerns.
And we'll be asking those members from each sector to hold these roundtables.
Yeah.
And we've got people who said, I'd like to be a part of the conversation. I don't want to sit on the committee, but I would like to talk to somebody about it. So we're really planning to have little circles of conversations going on that then come back to the larger group.
That's really good. I mean, this is going to have to move fairly quickly too. So we can close public comment, I think, on that. Thank you, Janet. I see that Paul and Leslie are still on. You guys can probably drop off at this point if you want to, right? Do we need them for anything else between now and back to Friday? Okay. Yeah, Leslie, you don't have to stay on. So next we are on to the PIO. I think Greg came on.
I did, Madam Chair. Good evening, everybody. This past week was pretty busy, but not for the normal public information activities. In fact, we only had 2 requests from media for interviews, one from WHDH and one from WKTK, and I think the chair may have actually addressed both of those. And then, of course, we have our regular requests from the Inquirer and Mirror. And we also had just very few material to push out, only 7 notices on the website and a couple of updates. But what kept us busy was a follow-up to the executive orders that really started in earnest last week. Florencia Rulo did an amazing job putting together the forms, the applications. So we spent a lot of our time last week refining the online forms, working with people who are calling us about the forms and questions about it, and then obviously just questions in general about the updated orders for construction and landscape, what that meant. We've worked really closely with the COVID hotline. I'll give that number out again just to remind people, but that is an officer, a sergeant in the police department who is just dedicated to answering questions regarding the coronavirus epidemic and our orders. Just to put in perspective, on the website, the statistics for the website for the applications, these are not actual applications that came before the building commissioner or the natural resources director, but we had 1,402 total applications in 1 week entered into the system. They may not be completed, like I said. 899 were for single worker applications, 302 were for construction projects, and 201 were for landscaping. So that's quite busy. And that's actually only through Saturday of last week. So in addition to that, we were busy trying to translate everything into Spanish, Portuguese, and Bulgarian. So huge kudos to Florencia Rulo for translating the orders into Spanish, a direct translation, not just a summary, and to Vanessa Rendero for translating the orders into Portuguese, and to Brooke Moore, who helped orchestrate this, and also found somebody to summarize the orders in Bulgarian. They're not full translations, they're just summaries. So those are on the website. And so we did a lot of work this week updating the website. The website remains our number one tool to reach out to the public. This past week, we saw a huge increase shoot up in the use of the website. In fact, we had 69,338 visits last week alone, just on the website, the vast majority on the coronavirus pages. And that reflects a 28,000 hit increase over this time last year. So that's pretty significant. We're at about 318 hits for the past 7 weeks on the website, which is 179,000 above this time last year. So the point being, the website is our biggest tool that we're using. So because of that, we've created additional pages this past week. Again, Florencia has been amazing, just trying to be reactive and reactionary to what the board is asking and what the town manager is asking. And speaking of which, we've created a separate webpage for our seasonal residents. So we put information on there, such as the outreach letter and the clarification letter, as well as other information that we've assembled elsewhere from the website and FAQs for our returning seasonal guests. And so we encourage everybody to visit that page. And for the most part, we're just this week working on outreach for the, like you said, the returning visitors, and continuing working with the public on the executive orders. That's pretty much where we are. If you have any questions.
Any questions from the board? Jason?
I just want to say thank you for all the effort that's going into translating and making sure, every avenue is looked at to get the word out and information out to, all parts of our community. So thank you to everybody that Greg listed off, and to you as well, Greg. Thank you.
Thank you.
Thanks very much.
Thank you. Good night.
Good night.
I mean, goodbye. Turning off.
Town services status.
Okay. This agenda was issued before the governor's order came out the other day. So town offices do remain closed to the public through May 18th at this point. We do, however, have a number of town employees returning to their offices this week or next week, or continuing or commencing remote work. There are, as I think I've said before, a lot of preparations that need to be done in public facilities to get them ready for not only employees, but the public, including signage, sanitizing stations, plexiglass or other types of barriers. PPE needs to be made available. A lot of different things. We need to determine cleaning is going to need to increase as well. So there's lots of things like that we're working through right at the moment, but people are beginning to return to work. We continue to have weekly calls with the emergency response team to check in with each other, see what's going on, how things are going. The board gets the daily situation report. We do try to be in daily communication with the employees, whether it's by a video from the HR director or myself or somebody else, or sometimes we do a little survey, a little fun survey, or today the water company did a nice video, the sewer department did one a week or so ago. And so we're trying to mix it up a bit and just keep people connected. The staffing, as far as, we do hear things like our town employees going to be laid off or furloughed. That is something of an unknown right now. Both of those, as I've said before, require collective bargaining. And we have not ruled it out. We haven't necessarily ruled it in, but it's one of the options on the table going forward to deal with the budget issues for 2021, which you'll be hearing about either tonight or Friday from the finance director and myself. I think that is about it. You probably have seen DPW out and about. They are one of the departments that's getting back to work. I saw a couple of crews today myself. Sometimes we need to work a little bit on our PPE protocol, but it does take some getting used to by all of us, and they are definitely aware and are working to make sure that they are covered in that area. So I think that's mostly it. If the board has any questions about town services.
Should we just turn on public comment for a minute, just in case, refresh if you have any comments or questions about town services? While we are waiting to see if there is anything, we could move on to the update on the census. Does someone know exactly where we're at with our numbers on that?
I do not know, but
Jason maybe does.
I think I heard on Monday or Tuesday we were at 19.2%. I'm hoping that it's higher than that now locally, and I think the state was at 45 to 50% in completed census.
People, please fill out that census. It's online. Please, please, we need it. Are there any public comments that have come through?
They don't really seem to be related to the town services. There's Albacore Charters asks boating and waterfront. I'm not totally sure what that exactly means, but the Marine Department staff is getting back to work to finish up what can be done for the town pier operational wise. Of course, there's a much bigger project there that has had to be delayed a bit because of what's happened. And then there's just a nice comment from Amy Aldridge. Thank you, everyone. We know this is a very hard time, but thank you again. And that's it.
Okay, thank you. I think we can close public comment now. We do have committee boards and vacancies. I believe that that's all that information is in the packet. And people, please apply. And we will be making those appointments in June. But we'll be able to afford the ability for people to speak using the Zoom if they apply. Jason?
When is the deadline? When's the next deadline? So we can get that date out there. People need to apply. And where do they, I know it's on the website, but maybe we can get that link around so people can get that sheet to apply.
Jason, so the deadline, we have two deadlines. The first one is May 22nd for the first round of committees that go from agricultural to historic district commission associate, and that will be for a public hearing on May 27th. And then May 29th is the second deadline for affordable housing trust through ZBA, and that's for a public hearing on June 3rd. And all the information is on the website.
And I mean, just to be clear about the actual practice, the board has consistently accepted applications up until appointment. So the deadline, I'm not sure exactly.
The deadlines aren't regulatory deadlines. The deadlines are administrative, just so we can get information into your packets. But it's never been a hard and fast rule that applications have to be in by those deadlines or else they're not considered. It's never been like that.
Okay, thanks. got to get to my agenda here. Should we open public comment for a moment in case there's anything that was not COVID related? Rita, did you have a comment?
I just wanted to say, I was just looking at the YouTube comments and someone mentioned childcare for returning workers. And I do want to say that Taylor Hilst from Department of Health has been doing a lot of work on that. So there are resources on the website for people that are concerned and looking for how to get back to work, but also have children to care for. So I just wanted to mention that and bring that up and make sure people know that we think that's important and have been working on it.
Thank you for mentioning that. Anyone let me know if any public comments come in that are non-COVID related. We will move on to approval of treasury warrants and pending contracts. If we could take those together, unless there's any questions or comments. Can I have a motion?
So moved.
Second.
All those in favor by roll call, I'll call your names as I see you. Jason Bridges.
Aye.
Matt Fee.
Aye.
Rita Higgins.
Aye.
Christy Ferrantella.
Aye.
John Holgate, aye. So those 1 and 2 are both approved unanimously. Then we have 2 citizens departmental requests. We have one from CNC Construction to extend their deadline. Does anybody have any questions?
We have Brian Cooney from CC Construction available if you want him to review it or if there's any questions.
Does anybody have any questions? I mean, this is pretty consistent with the waivers we granted last week for things to extend, but Brian's there if anybody has any questions on what they're doing. Hearing none, just some.
Yeah, maybe just a quick overview of what we're exactly talking about. 30
Brian,
seconds.
can you give us the real quick overview?
Yeah, so the 2 project locations are the North Liberty Street area. So basically North Liberty Street in between Westchester and Cliff Road. And also off of North Liberty would be Darrymore, and then Grant Ave, Nantucket Ave, and Cabot Lane. Those will be the 5 primary areas that are part of the North Liberty Street sewer and water expansion project that will need reconstruction. That work was scheduled to take place in the month of May, as far as reestablishing the roads, paving the roads, getting them ready for summer traffic. And then the other project is the Bathing Beach sewer improvement miscellaneous, which includes Race Court, which will be substantially complete by the end of May, Wall Street, which will be complete. The only work that may be extending there may have to do with some work down at Jetty's Beach regarding the pump station improvements to help assist with the restaurant. But we're hoping that that wraps up a little bit sooner than the end of June as well.
Thank you. Is there a motion?
Move approval.
Second.
Okay. All those in favor by roll call: Jason Bridges.
Aye.
Matt Fee.
Aye.
Rita Higgins.
Aye.
Christy Ferrantella.
Aye.
John Holgate, aye. That is approved unanimously. Thank you, Brian. You don't have to stick around if you want to drop off. Have a good night.
Thank you guys. Appreciate it.
Libby?
I just want to mention there's a public comment from Mary Longacre. Any guidance on when non-regulatory committees will begin to meet? I would say not quite yet, but as to an exact date, I'm not sure. We are still spending a massive amount of time, like almost all of our time, on COVID-related items. And we are going to be having a little bit of a hard time figuring out. We need more time to figure out when these non-regulatory committees are going to meet and how they are going to meet. Because right now, because of the capabilities of NCTV and other technology, we can really only have one Zoom meeting at a time. So if that, and I don't think we're ready yet to go back into public buildings, even with social distancing. We are not equipped for that at this point. So I think just hang tight and stand by, and it's definitely on our list of things to tackle, but just not quite yet, especially with the stay-at-home order advisory being extended.
Yeah, I think we'll start to talk about that sometime in the near future, but not yet in terms of meetings. Erica?
If I could, I would just note too, it's been a little bit of a juggle to get all the meetings that are meeting right now as it is, and to add those extra meetings into it, it's going to make things really, really difficult. So.
I just wanted to mention now, because I know that the school is probably here for the budget, and with us coming up on 3 hours, I'm thinking that this is going to end up being the Friday item. And I'm sorry that you've been here this whole time, but it was helpful to have you here for the election discussion. But I don't.
Okay, I will be on Friday.
Thank you. Thank you, both of you, but you can drop off now if you want to. I think we're going to try and wrap this up in the next half hour. As well, the Nantucket Pulse for Friday, we're not going to be able to do that at the same time. So that either needs to be pre-filmed, or we're going to have to not do that and do it a different time. So I just wanted to mention that as well. I see Greg shaking his head to talk about.
It can be pre-filmed if you'd like.
Okay, so we can talk about that.
Okay.
About getting it pre-filmed. Next up, and next we have Bess Clark. I think that she is on to discuss the retail. There have been a lot of concerns about curbside pickup for some items that aren't necessarily considered essential. And I think Bess can speak to that at this point.
Yeah, thank you so much for inviting me tonight. I am Bess Clark of Nantucket Looms, and I'm speaking on behalf of a number of local retailers. And currently, as the restrictions stand, we as business owners are allowed to be in our places of business. But if we were to be seen filling an order and putting it curbside, the police would be called on us, and this has actually already happened. Some merchants have taken to posting their items in the mail, which means that they actually leave the island to then get delivered back so that they can be delivered by the postal system. And, we really respect and appreciate all that's been done to keep our community safe, but common sense seems to think that there could be maybe a little bit of an exception made for our island, which, is exceptional in the fact that we cannot go to a Target or a Walmart next door or in the next town over to get non-essential items. I'm a mother of 3, and I can't get my kids art supplies. And so I've been ordering a ton on Amazon, which means my money is not staying on island. And I think as retailers, we're confident we can stick to the social distancing restrictions and fill orders over the phone or online, and then leave them curbside and limit our interactions or deliver them. So this petition that we're hoping that you could support to go to Governor Baker would be to take into consideration our unique circumstance of not having other options of places to shop. And we know we have the community who would like to support us, and we in turn could support our community.
Does the board have questions or comments for Bess? They've drafted a letter to ask the governor for an exception and wanted to know if we would support it.
Yeah. Matt? I've spoken to a couple of realtors downtown, and sort of I echo what Bess is saying. It's a difficult situation. Some of these guys put hundreds of thousands of dollars, and they're getting pressured, to buy stock for the summer. They're being pressured to still fill those orders, but they don't even know if they're going to be opened. It's going to be a difficult situation. And similar to the restaurants, I think what you're asking is completely safe if done properly. I think the real question when we go forward with retail is, how do you go into a store and not touch something, or all those types of things that everyone's used to doing are going to be very difficult. And so I think the first step is what Bess is saying, is how do we just put it outside or hand it safely. So I would support putting my name on that for sure.
I was somewhat thinking that even if the governor wouldn't grant an exception prior to May 18th, this letter may help inform some of his decision making in regard to phase one, because it does seem to me like one of the safest things that could be happening is curbside retail for non-essential items.
Yeah.
Matt?
The other issue here on Nantucket is there are plenty of owners who are not here, but their staff run the store, their staff does it. If it's not the owner necessarily, it could be, the manager, and that's the only person that goes into the store. They clean before they go, when they go in, they clean on their way out. That, there could be things like that too, which they've asked for. I just wanted people who are watching this to understand.
Yes.
I just want to add that right now, the stores that are essential to us on island are a liquor store, the grocery store, and a lumber yard. So, we're limited to what we have access to.
And off island, like you said, places like Walmart is considered a grocery store, but they have a lot of other items that are available to people.
Mm-hmm.
Christy, and then Rita.
Yeah, I was just going to add that I'm of course completely in support of this. I think if we can do it safely and we can do curbside food delivery or lumberyard, marine home center, then it makes sense. There's items, with everybody trying to teach from home or trying to get a book at the bookstore, there's things that I think are essential, or what we would deem essential, that could easily be left outside and paid for in advance. I think anything we've been saying all night, how do we be creative and how do we help support our businesses? If we don't take actions like this, I don't think we're going to have a lot of businesses on Main Street come fall or next year. So I fully support this.
Rita?
More or less similar to what Christy was saying, that I think it sounds like it can be done safely. And I think regardless, it is worth sending, like you, Dawn, said, I think it's worth sending because I think it could be very informative for the governor in the next phase if it's not allowed before the 18th.
Jason?
It can be done safely. I started doing it this week, and it can be done really, really safe. And so I know it can be done. I support it. A couple thoughts of Christy, you said, business on Main Street, but even mid-island businesses, right, would be, much helpful in retail, island varieties of the island. And so I will support it. I just want to make sure, the governor's office, we go to them and say, please let us restrict more. Please let us restrict more. We find ways to do it with the Board of Health. And then we go back with more letters saying, well, not here. But it is true, right? This is the thing that, the state always rolls their eyes at us because it is different here on Nantucket in so many different ways. But I just want us to be just careful on how we go forward with the governor with these type of requests. But I do support this.
Thank you.
How do we want to proceed? Do we want to agree to sign on to the letter? Have the letter be sent with like a cover letter from us? What are you guys thinking? Rita?
I was just going to say to Jason's point that maybe a cover letter, sort of some of the things that we've just discussed this evening as to why, we would want to sort of make an exception for this. I think, again, making the point that we really don't have the same shops and facilities that are available off island already included within the essential services. And we do want to support, rather than Amazon all the time, we would rather be supporting local businesses when we can. So I think a cover letter would be very helpful in explaining this in this one.
I'm hearing consensus on that, I think. I don't know, Libby, would you be comfortable drafting something and sending it on up?
Sure. Well, I could draft it maybe and send it around to you all to.
Yeah, but then sending it up if everybody's good with it. Is that fair? Do we want to make a motion in that regard?
So moved.
Second.
All those in favor by roll call: Jason Bridges.
Aye.
Matt Fay.
Aye.
Rita Higgins.
Aye.
Christy Ferrantella.
Aye.
Von Holgate, aye. Thank you. Thanks, Bess.
Thank you so much, everyone. We really appreciate it.
I'll let you see the draft. And Libby, did you have a comment?
I'm just going to say there's a couple public comments.
Oh, yep, go ahead.
Billy Cassidy says, I hope this board will support Bess's request. Amy Eldridge asks, can the town overlook this as long as it's a curbside pickup that is happening? I think the answer to that is not really, no. Alice Crowley asks, how would supporting this letter reinforce the stay-at-home order? Isn't that why the Commonwealth has essential versus non-essential? Norm Frazee asks, is there a task force for hotels and inns? That's not really totally related to this. And there's something else about, from the same person, have we thought about what restrictions state or local government might put on private clubs and hotel pools? So that's not really related to this.
There was a lot in there. Maybe we can get back to some of those people with answers, and we should probably turn public comment off at this point. But I think that Bess, you can drop off. That's we'll get you a draft.
Okay, I appreciate it, everyone. Thank you.
I guess that brings us to if there are any separate committee reports, because we will put over the budgetary discussion till Friday. And I am thinking in terms of organizing Friday that we should discuss the budget first and then move into the COVID phasing drafts. Does that make sense to everybody? Okay. So no other committee reports? I said another half hour. Matt?
I hope we don't have a half hour.
No, I was thinking maybe we had another 10 minutes.
No, and speaking to people, one thing that was interesting this week was Vail, Colorado. Someone that is living out in Vail says that they've set it up to have to welcome their residents back to their homes, but everything else is not welcome. And so, and I've asked them for information on how they did that and why they did that. I haven't received that. They also did something I did share out in Eagle County, which was sort of a outline of sort of their slow, medium, full opening and what it will look like. And it was in a really simple format. You'll all get it, but it was in a really simple format. It was a little hokey because it, had green, blue, and black ski signs for what it would do. But it was good because it set the tone. It's simply of, we aren't going to be all the way open in some of these for a long time. And I think there still is that expectation. Like I said earlier, I think a lot of people can't imagine that things will be that much different. And I hope that everyone I answer, I try to explain it's going to be very different. We're not going to be, sort of full throttle this summer. So I think the more that we could sort of start keeping that in front and center, I think the better off we'll be in the long term, just in our messaging and in how we present it.
Thank you. Any other comments? Is there a motion?
So moved.
Second.
By roll call: Jason Bridges.
Aye.
Matt Fay.
Aye.
Rita Higgins.
Aye.
Christy Ferrantella.
Aye.
Don Holgate, aye. Thank you all that are still on and watching. And we will reconvene on Friday at 5 o'clock. Same channel.